Get the name of it? Okay.
Also gave it to you just
Okay.
Oh, you, I ain't know you took it with you because I left my seat, so I thought it was going to be on the table.
Oh, no, you know they wouldn't do that. That's why they put it right
No,
there.
no, that's what I said. I said it's here. Because I thought they probably
All right, so I've got the recording on and the mute off, so we should be recording live now. Thank you all for being here and for bearing with our little bit of a late start. It took me like 4 elevators before I got up here.
Right?
Yeah.
Busy time. Busy time of day. So for today, as we talked about yesterday, we're gonna go through hopefully sections 6,
Mhm.
7,
Module
and 6, 7, and 8, hopefully.
Module
6,
6,
7,
7,
and 8 is our goal for today. And then tomorrow we'll finish up with 9 and 10. 10, most of which is a game, and the game will help us kind of review and summarize everything we've learned. All right? So we'll, the last section on tomorrow is probably not going to be a full 6 hours. We'll see how it plays out, but
Okay.
we'll get into it, play a couple of roles a couple times through the game, give you guys plenty of time for any questions or concerns or things we need to review, and we'll go from there. Don't want to do that. Okay, you don't need your OneDrive logged in, right, Felicia? Or actually, this is mine. I logged in on the computer. Okay, so we are going with 6. Okay, there we go. So let's get into section 6. In your guides, it's going to, in your booklet, it's going to be just 6.1. And as you can see, learning objective essentially is to list it for this section is going to be to list the differences between cleaning and disinfecting solutions, common examples of each, and how each is used. And again, the title of this, just so you're aware, is isolation room. So we're going to really be getting more into the nitty gritty of what makes an isolation room different than a regular either discharge clean or a daily clean. Okay, so determine the right cleaning solutions, tools, and techniques for different patient settings and surfaces, recognizing different types of waste and how to handle each, key principles of infection prevention and control. These are like the overall, goals that we're going for in these sections. So a little bit of review for you. Okay. A little bit of review. What are 3 differences between discharge and occupied cleaning? So what are the 3 different things you do in a discharge that you don't do in occupied room? And if you look on your page 5.16,
High dust.
you can write these in. You already wrote them in kind of on page 5.16. So high dust is one, yeah, what's another?
Making the bed.
Yeah, making the bed. We don't really do that during when the patient's in it.
Clean the mattress.
Cleaning the mattress, right?
Mattress
Anything else
that we do.
that you do in a discharge that you wouldn't necessarily
You know what?
do?
We take out those porta potties.
Okay, that's a good one. Yeah, that's a good one. Yeah,
And,
The,
but
the
people don't know
commodes.
the bag and tag.
the commodes, yeah.
But now, are we supposed to wipe them? Because I wipe them.
Yeah.
Okay.
Just give them a quick surface wipe.
Yeah, that's what I
When they
mean.
go down to SPD and get like run through the actual the sterilizer
Uh-huh.
or the wash, it's like almost like a car wash kind of. So they
But
can run
are
through
we
it down there.
supposed to take them down or is the aid?
No.
Because I
Transport
wanted
takes
to
them down.
say, no, not down to the,
We take them to the
the
soil
sterile.
room.
Oh.
But it is our responsibility or the
Right.
aid
Get to the soil
To the
utility.
soil utility room.
is our responsibility.
Yes.
Ah,
And it's kind of a Roswell specific stuff. You know, we've been talking right along about things that are in these guides as like the standards nationally. But then we also will always have some of our Roswell specific things that we do. And that's a good example of that, Becky, is, those commodes are something that we give a quick surface wipe down, bag it, tag it, and then put it in the soiled room. And then transport comes by and picks them up. Takes them.
Okay, now how about the chemo bin? Do we drag it down to the dirty utility room?
We do not touch chemo bins unless they are snapped shut.
That's what I'm talking
Okay, unless
about.
they're
They're snapped
totally
shut.
snapped shut
Uh-huh.
and full,
Uh-huh.
then we can take them to the soil room.
Drag them.
Does nursing?
Isn't it drag them?
Patient floors, does nursing take them?
Nursing take, well,
'Cause I know
No, I
in
take
chemo-
them.
In chemo infusion, nursing takes them to the soil room, and then we pick them up from the
it's a
soil.
joint effort. Because
Oh, it's a
we don't
joint
know-
effort, because I do it.
Yeah.
Yeah, they're not hurting anything by doing it. You okay, Mom?
I leave it out on the, they leave it out on the thing, and you drag it down the hallway. They told me drag it.
I don't love the dragging on.
They said drag.
If it's too heavy, to
It's too
carry,
heavy.
if it's too heavy to carry, drag it, but if it's light enough, carry it.
Oh, okay, because I told somebody, I said, no, I think you drag it.
I mean, if it's heavy, of course, we
Yeah,
don't want you to
some of
lift
them
it.
can be. We don't want you hurting yourself lifting them. But if it's light and all it's got in it is like gowns and stuff.
Oh, okay,
pick it
good.
up,
Okay.
then carry
I
it
didn't
on.
know.
Okay.
I didn't know what to say.
Why should you carry linen away from your body?
To stop the spread of infection.
Right, exactly. Name a high-touch area in a room.
Toilet, sink.
Toilet sink, yeah.
Bed
Bed rails.
Switches. Remote.
Yeah.
Telephone.
Telephone.
Cell phone, definitely. What was that? IV pole?
IV
Yeah,
pole.
for sure. Okay. What's the proper way to clean a mattress?
In one direction.
All right. And then, where do you put soil linens?
In the bin, and in the dirty utility room.
So let it happen.
Oh, and the soil, yeah, hampers, soil.
Okay? You don't put it in the garbage, you don't put it on top of your car.
Okay, but if it's messy, if it's torn.
Reject it.
But you're going
If,
reject.
unless it's soil, if it's torn and it's clean, it goes in the rejected.
Yeah, if
Okay,
it's torn
and if
and
it's
soil,
soil
just
and
put it in the
soil?
Put it in the soil. They'll take care of it at Columbia
Okay.
plant.
All right. Just throw it in there anyway.
Mhm.
Talk about-
Pillows too?
No, pillows are ours.
Okay.
If they're torn,
Throw
toss
them
them in the garbage.
Name several ways in which you are a role model.
By being on time, doing your job the right way.
Mhm.
Cleaning process.
Yeah, following the policy of cleaning.
Okay. All righty. So it wants us to list on your page 6.3, some things you remembered from last session. That's kind of what we just went over.
Mhm.
All right. So some of the things we just talked about were, proper way to clean the mattress, how to be a role model. If you want to write those things down, great. If not, I mean, they're back on page 5.16 anyway, the things that we remembered from the last section. So that's up to you if you want to rewrite them.
No, I like that.
But those are the things we learned in the last section. So this section on your page 6.2 is going to, the agenda is listed there, and the things we're going to go over. So we're going to review infection control and prevention. It'll take about 20 minutes. We're going to look at isolation PPE. We've already kind of gone over that with the donning and doffing, but we'll talk a little bit more about, the specific isolations. We're going to compare and contrast room types, things like private versus semi-private, like those kind of things, negative pressure, that kind of thing. We're going to talk about cleaning versus disinfecting.
Okay.
And we're going to talk about segregating and handling waste, safety hazards associated with isolation rooms, and then a quick knowledge check. This is about a 2-hour session. Okay, so make sure your cell phones are turned to stun or to vibrate, please. And we're going to get underway. Okay.
Oh, yeah.
All right. So as you can see from our,
No, I didn't see that.
so as you can see from our little mock-up room, mock-up hospital here, we're moving into module 6, which is isolation room. So again, we're going to discuss handling waste and segregating waste and other things associated with a isolation room. So what do you remember about standard precautions?
Standard precautions, glove and gown.
Okay. Yeah, standard is the thing we do when? When do we use standard precautions?
When we go in the room daily.
All the time.
All the time.
Anytime we're working. Right. Anytime we're working, we wash our hands, we wear our gloves. Gloves and hand
Hand washing.
all the time. What about transmission precautions? What's different about those? How many different types of transmission precautions have we discussed? Three primary ones, yeah. And those are?
Contact, droplets, and airborne.
All right, those are the three. And pretty much everything we get here will fall under one of those three. We do have that Contact Plus that is a Roswell specific, and other hospitals do have a version of Contact Plus, and that's mostly for C. diff. It's a way of signifying to us that A, we have to wash our hands with soap and water, and B, we have to use bleach cleaning, all right, to kill the spores. And it's a way of signifying that without telling everybody the patient has C. diff, because we're really not supposed to give diagnosis. Is this for me?
Sorry, I want to interrupt, but I don't
No,
know.
the answer is no.
Okay.
Okay, I will let go. So those are some of the things, again, if you want to write those down, the things about transmission-based precautions, there's 3 different types: contact, droplet, airborne. There is a, the differences between them, we'll get into in great detail. What about some things that are different with each?
What did you call it? What did you call it?
Transmission-based? Yeah. What are the things you think are different? So let's say between contact, droplet, and airborne. For contact, what do you do? What do you wear?
Oh, for contact, you just wear gown and gloves.
Gown and gloves. What about for droplet?
Droplets, droplets was just.
Droplets, you gotta wear.
Just a mask.
You gotta wear a mask, gloves, and apron down.
No. Just gown.
Gown.
Yeah, all 3 you gotta wear.
No, you just wear mask, gloves.
Yeah, we have the sheet. Here we go.
No gown,
Oh, the droplet, mask,
gloves.
and gloves. Okay, now because really the infectious agent or the infectious material is the droplets, the sputum, the respiratory secretions. Remember we talked about that?
Yes.
So, I mean, if you feel more comfortable wearing a gown too, I'm never gonna begrudge you that. I'm never gonna say, nope, don't wear that gown. Wear what you feel comfortable if you wanna overprotect yourself, but as far as what's prescribed for that room, it's basically mask and gloves. All right, and again, they all say in addition to standard precautions. And then finally for airborne, what are we wearing for that?
Mhm.
N95 or that PAPR, if you've been fitted with that PAPR, which is the thing that goes over your head with the pack that you wear. But most people just have the N95. The patient should be in a negative pressure room, and you're gonna have gowns, gloves, the whole 9 yards. All right, so the airborne is the one we gown up top to bottom. All right, and again,
N95, right?
N95. For any of these, if you feel that splashing or splattering is likely, safety glasses or goggles or face shield, okay? Anytime you feel like you could be splashed or splattered, you're gonna go with a face shield.
Now, when we come out of that room, we take off everything and then find our face shield and then go back in the room, put back on everything?
What do you mean?
Like, if say I forgot my face shield, but I didn't know that until I got in the room that something was splattered.
Yeah, once you've been in the room, you
You
have to,
can't leave.
you can't leave with all that stuff on. You
No,
have
I
to-
won't leave with it on, but I'm saying I'll take it all off and then redo it?
You'd have to, yes, if you were going out to get a face shield.
Yeah, okay.
And the rule of thumb for isolation, you're not supposed to leave the room until you're done cleaning it. So
Right.
you're not really supposed to.
Yeah, I don't leave it come
Make
out until
sure.
I'm done.
Make sure you have all your stuff before
Yeah,
you
I
go in.
do. Yeah.
Okay. Okay, so the chain of infection, we talked about that quite a bit. There's how many links in the chain of infection? Right, 6 links in the chain of infection. It can be broken by several things, okay? What do you think are some things that can break the chain of infection?
Wearing your gloves, washing your hands.
Yeah, proper hand hygiene,
Hand hygiene.
good overall health, making sure you're healthy, you have your
Yeah.
vaccinations,
Yeah,
we talked
get
about
all your
that.
vaccination.
All right. What's the one thing we do every day that can help break the chain of infection? What do we do every single day? What's our job?
Just to get prepared.
No, well, you were gonna say it. You
I
started saying.
know, but I don't know if that's the answer.
That's the answer. Go ahead, say it. What do we do every day?
I know.
Right, yeah, what?
Disinfect surfaces, yeah.
Yeah.
Proper disinfection, okay? And then one thing we talked about also, what do we do? What's the step one? Well, after knocking and introducing yourself. What do we do? Step one of our 7 steps is what?
Wash your hands.
No, step one of the 7 steps.
Oh.
Well, trash, moving
Yeah,
trash,
yeah, yeah.
proper trash
Seven
disposal.
steps.
That can help break the chain of infection.
Okay.
So cleaning and disinfecting in an isolation room requires you to follow all the approved processes, okay? And, you know, we're gonna watch a video that kind of talks us through some of the chain of infection. Do this on here. Videos, that's really far away.
One more down, I think.
This
Yep.
one?
Yep.
Okay.
Oh, I think we ran into this last time.
Well, let's hope we have
I think we did.
sound. I don't hear it. Tracy, can you check on that panel and see if there's a sound adjustment?
It's on 100.
Hold on.
Let's see. Yeah, it's on.
I know.
See the mic over there?
What's
That
that?
slash- See the mic right on there? Felicia, it looks like the mic could have a slash in it.
Yeah, that's Felicia's computer
Oh,
downstairs.
oh,
Let me
I
speak
thought-
by
I
him.
thought it was the sound.
That just means her microphone downstairs is off.
Oh.
Oh, sorry, I could have done that.
I didn't know where. I don't know if it's even on.
Oh, here we go. No? I want it to blast us either.
I don't either. Hold on, let's see, so that's on 80.
There's nothing.
I know I have the mouse down there. But it's turned up.
Well, I think there's a caption option too. If you hit
You got a
here,
mouse?
there was like a
Yeah, wait.
turn on live captions. I mean, worst case, there's probably subtitles, but
Well, that's just captions of you talking.
crud.
All right, technical difficulties. Felicia, can you restart that video? And we're gonna keep trying till we get some sound here.
He did it the other day.
Where's the key? It's not the keyboard or the mouse, right?
Here's the mouse.
Oh, yeah, the mouse and keyboard.
Yeah, should
Pass
mouse
it
on
down.
there.
Thank you.
And the keyboard?
No, I don't need the keyboard.
That's gotta be, it's probably on mute. No?
No. Those things.
Okay, so it's not that. It's not that. It's gotta be process of elimination. It's gotta be the
It's probably
TV.
the
It's
TV.
gotta be the TV.
Not the TV.
TV.
Turn on your speakers to hear the meeting. What speakers? Or we don't need that. Your incoming meeting audio is on.
I think they turn on the speakers.
Let's try.
We can't go any higher here.
Why is there not last we review some things?
Okay.
What is the dwell time? Bleach?
5 to
And how
10.
do we dilute bleach? What is the ratio?
1 to 10.
Okay, hit escape. Hold on. You hit escape on that keyboard. Okay, now. I want to get out of this screen.
Why don't you try going into like, I don't seem stupid, but go on like YouTube or
I
something and
just
see
want to
if,
get out of Teams right now.
right, cause see maybe it's that. Or
Hand me the keyboard, I guess.
Yes,
I'll figure this out.
Or go on,
Yeah.
but go on like a YouTube or something and see if like just volume's working, period, and then we know at least we can roll that out. Do you know what I mean?
Yep.
And then we can kind of figure out what to go from there. Sorry, Felicia.
Now what's dawning?
Dawning is putting on,
And then doffing?
is taking off.
So, in what order do we don?
We're going in.
You take the gown, put the gown on first. Then we put the gloves on last.
Yep, what we do in between?
Rapid response, main hospital, lobby, in the doorway. Rapid response, main hospital, in the lobby, in the doorway. Rapid response, main hospital, lobby, in the front doorway.
Taking it off with gloves first.
Take the gloves first.
Then gown and then mask. I did that yesterday when I went into that room to clean, because I knew it wasn't done. So I went in there yesterday when I came back, and that's what I did. It was better. Even though I felt bad still having this on my nose, while everything else was getting off.
Yeah.
But I just did it. I said, no, it's away.
We got value. I got
I heard it.
Hang on.
Matt knows what he's doing.
The sound is
It's on the actual computer. It's coming out of the
Yeah,
computer.
You guys all here okay?
That'll be good.
Yeah, that's good enough.
We're gonna start from the beginning. Sorry for the technical difficulties, folks. And we are going to watch this video on disinfection.
Okay.
Solutions generally break down into three
Who knows what you're
categories.
doing, but.
Detergents that remove visible soil and dust. Disinfectants, sometimes referred to as germicides, that reduce, kill, or inactivate many or all fungi, bacteria, and viruses on inanimate objects or surfaces. Or third, one-step products that both clean and disinfect. The type of disinfectant solution selected for use by infection control and environmental services are EPA-registered hospital-grade disinfectants that are effective against most microorganisms and have specified contact times needed to kill those organisms. Bacterial spores, such as those associated with Clostridium difficile, are resistant to disinfectants. Therefore, a sodium hypochlorite solution may be recommended, especially during outbreaks. Disinfectants will also be selected based on the surface materials being cleaned.
Okay. I'll take over to Councilman King.
Alrighty.
Any questions on the video?
No, how to clean the surface?
Yeah, pretty straightforward.
Yeah. Even though I seem to do it in a circle of motion a little bit, but.
You're, well, you know. Let's see, where were we on here?
Yeah, 6.
Yeah, I'm just going on where he is on here.
6.9.
6.9, let's see, okay. Did we just watch 6.1? Chain of infection video?
We watched.
I think 6.5.
No, oh yeah, not, I'm
You
talking about
guys
video.
are 6.5. The video we watched, I think, is the only one for that.
Was it
None of them
6?
are-
Oh, was it a 6 video?
It was.
It was a 6, okay, good.
Yeah, they're labeled so wonky.
Okay. Oh, Matt already went over 6.9, that's why I was confusing it, wait a minute. Okay, so now we're on 6.9.
Yeah, we watched the disinfectant video.
Okay, appreciate it.
And I'll go back to it. We're on 6.
Okay, perfect. Yep, we just watched 6?
Yep.
Okay, perfect, okay. So we're gonna
Oh.
talk, oh, no, yes,
Chain of
yeah, we just watched that.
That's where we're at.
So chain of infection, if we remember, there's 6, right? 6 modes. And then we have what? Infectious agent,
Yeah.
reservoir, portal of exit, mode of transmission, portal of entry, and then a susceptible host. And that word comes in with our isolation. It's very important to pay attention to these isolation signs. Because knowing what type of disinfection to use can break the chain of infection. And also, you know, some of the patients, only all the patients that are on isolation, you know, they may have some possible contagion. So it's very important for us to pay attention to these signs to know which products to use. So how would you know what precautions to, what type of chemical to use if you just looked at this sign? How would you know? Because it would say,
Does it say bleach?
yep, it said bleach white because it's a contact plus. And then how would you know which isolation precaution to use? Because it would say right on here if it's contact,
Contact.
airborne, droplet, and then in our case, contact plus. Some isolation signs indicate, like contact plus. They do have it listed in my book here saying that some facilities do use contact plus, but it's not a standard that's used all over. Because a lot of facilities just use the 3, not to confuse people, but then some specialty facilities do use the complex plus sign, so we know if you see that plus, it's plus bleach.
Okay.
You have to use the bleach ratio.
Yeah.
So you always want to make sure you follow the policies and procedures for that specific isolation. I know, and then make sure you watch look at the doors before you walk in. We've actually had staff members walk into isolation rooms because they weren't paying attention.
Oh, just.
They said, oh, I didn't look at the door. They just walked on in. I mean, it's happened before where people have walked in just because they weren't paying attention to what was on the door. And then let's see, and as we said, some facilities may use contact plus, but just know that if it's the main 3, droplet, airborne, and contact. Also, alcohol-based and quaternary like disinfectants do not kill C. diff. Only the bleach kills the C. diff. Yep, just We just go, that might be on the test, because they keep bringing that up over and
Okay.
over and over again.
Yeah, but why would they be, if all the hospitals don't have it?
Well, because you still have to use bleach, because they might not have a Contact Plus sign, but they
Oh,
may
have
say,
something
yes.
Similar.
yes.
Okay.
And then you have to know if there's C. diff, you have to use bleach, because that's the only thing that'll kill the spores.
And MRSA, do we have to use?
No, that's just our hydrogen peroxide takes care of MRSA. Yet the only thing our hydrogen peroxide won't kill is the C. diff spores.
That's it.
That's
That's all.
it.
I'm writing that down, so,
Yep.
so I can.
Sorry about that.
That's okay.
That's how you run.
Yes, it is. Yep. Get it in.
Yeah, I'm good.
Okay.
Maybe I'll get that. All right, so what did we learn? Well, that was the way.
So we're talking about the, 3 Contact Plus, contact
Okay, different types of
and
isolations.
installations.
Okay. And, oh, thank you. So yeah, and have any of you ever seen these little boxes that hang over the door?
This is my first time really seeing.
So some of our clinics, we have these. There are some in some of the clinics. I think GI's got some, right?
Yeah, I never really seen it.
And head and neck does.
What's
I
that?
had a neck.
Head and neck, yeah, there's some of them have these that hang over the door. I've been in hospitals where this is their primary, like every room has one of these.
I never seen it.
So it's basically has everything you need for an isolation in there and stuff, some of the stuff's for clinical staff. Like they have these disposable stethoscopes and
Yes,
things like
yeah.
that, one-time use.
And the red bag.
Yeah, so some places will have that, but for us, we typically have those little yellow carts that sit outside the room. Okay? We were on this page here, Alicia.
Okay, well, we.
just talked about the
first
isolation
half of
part
that
and
other
then-
page. That's
Okay.
the first half I talked about.
Okay. So some things to remember, okay? Definitely follow our own procedures for disinfectant use for isolation cleaning. We talked about that a little bit, like, we may have, they may talk about the microfiber cloths in this training, but we use the peroxide wipes. So we have some specific things to run as well. And it does note that, some facilities have specific additional isolation precautions with signage that shows which disinfectant to use. Our one example of that is a C. diff claim, and that's our Contact Plus to clean and disinfect all surfaces with bleach. Okay. Alcohol-based and ammonium compound-based disinfectants do not kill C. diff spores. We've talked about this quite a bit. This is why either a bleach or another EPA registered intermediate level disinfectant with a C. diff claim. So there are other things that will kill C. diff spores, but the only one we have is the bleach wipes. There's other ones out there in the world, but we just have chosen the bleach wipes for us is the easiest, it's the simplest, it's the most controllable. Other ones that we've looked at in the past are like a tablet that you would drop into a solution and then you'd have a separate bucket to put it in. And we've looked at those before.
I did that.
Yeah, but a lot of times in the service, in the military, that's what they would use. They have, goes by a bunch of different names, but it's basically like a peracetic acid type of cleaner. For our purposes, it's just too much uncontrolled action on chemicals. You have to basically put this tablet in, it mixes up in water, you use it, and then after a certain amount of time, you have to dump it and you gotta label it when you've mixed it and all that stuff. We don't wanna do all that stuff. Just take your bleach wipes, use them, and you're good to go. But for us, we're all about making sure things are consistent, controllable, and that one person's not doing something one way and someone else is doing it another way. Because when you have that variance in how you're handling things and how you handle these precautions, that's when you end up with people getting sick. You end up with outbreaks because Becky might mix her peracetic acid one way and Wanda might do it another way. Or Becky might dump hers out at the end of the day and Wanda might say, well, I don't want to waste it. I'm going to save it for 3 weeks. And then next thing, I'm just shooting you guys. I know you.
Yeah.
I'm just saying, we take that out of the equation by just giving you the bleach wipe so we know what's going to kill. It's going to be the same strength for Becky as it is for Wanda. It's going to kill those spores and we don't have to worry about it. So if you're ever sure about which disinfectant you should be using in a particular isolation room, ask your supervisor. The best rule of thumb is peroxide wipe for everything in the world except C. Okay. Okay, any questions on signs and chemicals? Okay, so we did already do our donning and doffing. but we're gonna just kind of talk through some of the PPE that you might wear for an isolation. Okay, so wearing the appropriate PPE definitely protects you and other patients from infection. All right. When you wear the right equipment in the proper way, and I would also say when you remove the equipment in a proper way, the PPE in a proper way, you can break the chain of infection. So what are some of the required PPE for isolation rooms that you can think of? We're on
Required is gloves.
we're on 6.7.
Gloves.
Gloves, guns.
Yep, gown, masks, anything else? Yep, the respirators, N95 respirator for isolation rooms. And again, keep that in mind. You may hear it called a respirator. Some people just say, oh, the respirator. It's the N95 mask. That's what the respirator is. And it's actually, the full title of it is N95 high particulate respirator. And the reason is because it picks up and traps really, really, really small particles, way smaller particles than these surgical masks do. Okay. Okay. So we've shown you some of what's available here, and we tried those on the other day, so you're familiar with our type of PPE. Those plastic gowns we use were really for demonstration purposes, but we also have, paper ones and other versions that we use here at Roswell. Yes.
I have a question just because it's come up when we did the fit testing after orientation. So if anyone, and I think they said specifically on second shift, if they need to get the PAPR, what can you talk about the process for that? Because Bruce said something about a supervisor has to go sign something out, especially on second shift or weekends.
Well, the case
Sure
used to
everybody
be that there
knows.
were only 3 or 4 of them in the entire hospital.
Okay,
And that's why we did not actually espouse to using the PAPR, because it was such an inconvenience to even try and find them.
right.
Half the time the pieces were missing, or they were down in SPD and they hadn't been processed. Now they have purchased a ton more.
Okay.
So every unit has their own.
Okay.
All right, so they are on their unit. They send them down with some sort of cycle to get cleaned by SPD, but essentially they get wiped off in between use and are used several times upon the patient areas.
Okay.
So they should be in your nursing charge nurse or the nurse manager on your floor should know where the PAPRs are.
Just because a lot of our employees do have facial hair, so they
Yeah.
can't do the N95.
Yeah.
mask. Okay.
They should be in, typically where I see them is in the clean holding area, the clean holding room, either where the clean linen is or where they keep like, the lifts and stuff like that in their clean holding room. That's where I've typically seen them.
Okay.
But ask your charge nurse or even on off shift, there's always a charge nurse. They should be. able
I mean,
to get one.
well, how does it look? How does the mask look?
What does the PAPR look like?
Yeah.
Looks like a battery pack.
Kind of looks like an astronaut, yeah.
Yeah.
But there's a hood that goes over it.
Oh, I've seen that.
Yeah,
I've seen that.
Yeah, there's like a hood that goes over it. and it has
You've never
like a
used it?
tube that connects to like an oxygen pack, basically,
Oh.
which allows you to always be breathing fresh air.
Pretty sure you still have to get the head part from SPD.
Yeah, because I think we just got
Because
to.
they had the
We got
battery
the
packs on the
unit.
floor.
Yeah, because
Yeah,
he
yeah, I
said
think that's all
something,
we
and he
got.
said it just last week to me.
Yeah, no, because they had the battery packs on the
That's what I
floor, but
thought.
the hoods are per person.
But then
You
I thought
can't
maybe I
inter-
misunderstood.
Change the hoods.
Oh, you can't.
No.
So it's one hood and then we wipe them out when you're done?
We'll get, you know what, let's get
Yeah,
official
one
word on that
for
from
you.
OES and then we'll
Okay.
report back to you. Okay, I'll
Okay.
talk with
Yeah.
Joe Mazel and the OES team and we'll report back.
I mean,
to you.
I probably never use it, but I just.
Yeah, we use
A lot of the guys do.
all the time. We used to just say, you have to shave, you have to wear an N95. Like that was up until really COVID, middle of COVID, where we said, you know what? We just need to have another option for people because we can't have people, here to clean an isolation room and have nobody able to do it because they have a beard, or go make them shave on the spot. So that's when they invested in more PAPRs and just realized, we're gonna have to just tell people, okay, you're either or. Bottom line is we want to protect
We
you
don't have.
and we want you to be safe. So let me get the official, if there's an official document or an official
We can do it.
SOP,
Or just get a big, give me a big page.
an official SOP that OES is drawing up on how to handle the PAPRs, and we'll get that back to you before tomorrow. Okay? Okay. All right. So remember the order in which we do things, okay? When we take don and doff, it's up here on the wall. Keep in mind, donning means to put things on, doffing means to take them off. So donning, you're gonna do hand hygiene first, then first your gown is the first thing you put on, then your mask or respirator, then your goggles or face shield, and then your gloves. Doffing, gloves are first because they're likely the most soiled, and you're gonna wash your hands as well, okay? So you take your gloves off first, then your goggles from the side, and you're not grabbing the dirty part from the side, goggles or face shield, the gown, pulling it away from your body, okay? Then your mask or respirator, and again, trying to pull the elastic over your head and pull it away from your face without touching the mask itself,
Yesterday.
okay? And then always follow with hand hygiene, because if anything got on your hands while you were,
You gotta
doffing.
go all the way, I went all the way up to here.
Yeah, I mean, usually a little bit up your wrist is probably suitable, Have to do a full surgical scrub up your elbows, but
I
again,
just did, I just.
to me, more is better with that, with that kind of thing. More protection, more hand hygiene, it's not gonna hurt, it's only gonna help, okay?
Do we have other follow-up questions from yesterday? I think we forgot to do a parking lot.
No,
I don't think so.
No.
Okay.
We worked through everything.
Okay.
All right. So, go to page 6.8 in your guide. All right, you're gonna see the 3 columns there. Okay, and get ready we're gonna grab a stack of cards here. And we're gonna place these cards in the proper column, okay? And we're gonna place them in three piles. Discharge isolation, regular discharge, or occupied room.
I have 6.
6A. 6A, yeah, 6A. Okay. This is really to point out and contrast different room types, okay? So I'm gonna give you, I don't know if there's 3 sets of these cards. Maybe this might be the set we use. Full set. Well, they don't have any cards.
I know, right?
Then I can just count them and see. These are doubles. Triples. Okay, so everyone take just take 4 or 5 cards off the top, all right? Just take 4 or 5 and pass it down. We're gonna go through these and decide which category they go in. Are they gonna go into a discharge isolation room, a occupied patient room, or a discharge patient room?
4 or 5.
5. We're gonna go through all of them anyway. But I think there's duplicates. All right, so. So read the instructions on the screen. If you see it, there's 3 columns: discharge isolation, occupied, and discharge patient. Okay, so again, the verbiage that they're showing on the slide may differ from the what shows on the game cards, but it may not be exactly. So we're going to decide as a group whether each task on the card is most likely performed in a discharge isolation room, an occupied patient room, or just a regular discharge. Okay, so we're going to most likely keep that in mind. Some of them might go for both, or 2 or 3 of them, but we're going to decide which one is most likely. So Mo, what's your first card? Clean the mattress. When are we going to clean the mattress?
Discharge. Isolation.
Right, so discharge and discharge isolation. Right? Clean mattress is going to go on both of those. Becky, what's your first card?
Check RMW and Sharps containers.
Okay, so again, we know that this is something, we have Stericycle here who does our Sharps containers, so it's not really something we check.
Okay,
But when do you think it'd be appropriate to check those?
I do check them anyway.
And you check the regulated medical waste container.
Yeah,
yeah.
That's the first one.
Every day for me. I look every day.
Okay, but do you do them for discharge, isolation, or regular?
Normally isolation, because that's when because people can't go in the room. The people that pick up the Sharps, they can't go in the room,
Okay.
isolation room.
But do you ever check your medical waste at a regular discharge?
Yes.
Okay, and you check it when the room's occupied?
I check it when it's.
So that one might
occupied.
be all 3 for us.
Yeah.
We may
I
just
do
check
it
those
all
things.
the time.
Yeah, we may check those all the time. So
Yeah.
medical waste might be all
Because
3.
when you're wiping, you still see the Sharps and they be all the way up to the top.
Hey, Tracy, in 2 slides, I've got it, actually.
Oh,
So
okay.
you don't have to write them all down.
Oh, yeah.
Okay, we're just having discussion now, and then we'll go to the columns and
Yeah.
show you where they go. Okay, So that's likely for us, it's probably, we're gonna check them each time, in each case. Okay, Kapil, what do you got?
Is that all high touch surfaces?
High dust all surfaces?
High touch.
Oh, high touch surfaces, disinfect high touch surfaces. When will we do that? Discharge isolation, occupied or discharge?
All
All of them.
Yeah, I would say. I mean, in a discharge situation, we're gonna disinfect all surfaces, but the high touch ones are specifically in the occupied. But for me, it'd be all of them. They may say occupied only just because that's primarily what you do on an occupied room. But I could see all three. You don't have to write them down yet, because we're gonna pull up the, guide. We're gonna pull up the guide and show what they say the answer is. Wanda, what you got?
Perform and hygiene.
Perform hand hygiene. When are we gonna do that?
All
All of them. We're always doing hand hygiene. Doesn't matter which type, doesn't matter if we're doing an office, we're always doing hand hygiene. Wash your hands, wear gloves, all right? Before and after wearing them, you're washing your hands. All right. Sarita,
Clean pillows.
clean pillows?
Yep.
Okay, when are we cleaning the pillows?
Discharge.
Okay,
And the discharge isolation.
yeah, for those two,
Yeah, both.
for sure. You're not gonna be wiping the pillow when the patient's laying on
No.
it. It might make their head a little wet. Okay, and I've got, here, Alicia, I'm gonna introduce some too. What do you got, Alicia?
You already did that one. Dispose of isolation waste appropriately. Who wants to answer that one?
Discharge isolation.
It says isolation waste. so
Yeah.
That would be in the isolation room.
Yep.
Okay, I already did that one. Okay. I have greet patient, family, and visitors. Explain why you are there. And if necessary, use facility approved keywords.
And that is occupied.
Occupied.
Yeah,
You're
you're
gonna
not gonna
just
greet.
say good morning and who you are, just identify.
Yeah, and what you're there to do. Excellent. So that's gonna be occupied because there's patient, and family, visitors there. Okay, Mo?
Check trash can.
Okay, check trash can. Okay.
All of them.
Yeah.
Yeah, I mean, essentially, I think maybe what they're, and we may see when we see the answers, sometimes when these type of sessions, when they say check, they're thinking more of a policing, like check it and see if it's full. Maybe like we would do in the afternoon. If you go in the afternoon and there's one tissue in a can, you're not emptying it. So typically checking, if they're considering that policing, like going and just doing a quick check of trash, that's gonna be more what you would do in an occupied room. Cause you think about your afternoon trash run.
Okay.
If nobody's put anything in the trash, you're still gonna check it, but you're not necessarily gonna empty it. All right, unless it's got a bunch of trash in there. So you're not gonna, if you empty the trash in the morning, the patient didn't throw anything in it the rest of the day, you're not gonna go back in and take an empty bag out. But you're still gonna check it. But you're gonna check it. You're
Yeah,
gonna-
I've seen people do it.
So we'll see what it says when we pull up the answers, but
Okay.
my thought is that might be applying to occupied. Empty,
Say empty.
right, it doesn't say full empty trash, but it says checking.
This is check.
Right.
It's a trick.
Okay, maybe,
Mine's
it
is-
might be, we'll see.
Mine is remake bed with clean linen.
Okay, when are you gonna remake the bed with clean linen?
Oh, and it's a discharge.
Right, either isolation or a regular discharge, right? Okay. Feel,
Replace the privacy cubicles and shower curtains.
replace the privacy cubicles and shower curtains. When are we gonna do that?
Isolation rooms.
And
You
then
think?
discharge.
Yes,
Discharge
discharge isolation rooms. You gotta change the shower curtains.
Yeah, we're not necessarily gonna do it in a regular discharge room
Isolation.
unless it's visibly soiled with blood or bodily fluids.
Isolation.
Okay, excellent. Wanda?
Move items to dust mop and mop under.
Move items,
I think
dust mop
that
and mop under.
ISO and discharge patient.
Oh, we should do isolation room with, and discharge. You're saying
I would say
it's.
everything.
To mop under,
Yeah,
everything,
everything.
mop items to mop under?
Yeah, but they say move, they say
They said move
items.
items.
Dust mop and
dust-
mop.
You can't do it when the
It's
person's
not
under.
the patient is there.
You
Yeah,
can't do it.
within reason, I mean, you're
It's
gonna,
the bed,
you're
just the
right.
bed.
You're gonna mop under what you can when
Yes.
when the room's occupied, but you're not gonna be like wheel, oh, excuse me, Mr. Patient, wheel you across the room to get under the bed. Exactly. So I think
So
I think you're gonna do as well as you can to, like, you're gonna move the chair out of the way to mount when
Mhm,
it's occupied, but you're not moving the patient's bed while they're in, that's for sure. So yeah, I think it's probably the two different discharge. Okay,
So it was isolation and discharge?
well, let's see, we're just having a discussion, we'll see what they say.
Oh.
I know what we say, you know, we'll see what they say. Rita,
That's all the same ones.
okay, then pick the next one.
They all the same.
Sure.
Oh, they're all the same, we've done them all? Yeah, there's 3 sets of cards all mixed together, somebody will go through and sort them.
Yeah,
Hold
I have
on.
one.
One surgical mask and then bar respirator. And appropriate PPE.
And that's in the isolation.
Yeah, definitely.
Discharge.
What kind of isolation is that gonna be in?
The 95.
And everybody was the airborne.
Perfect, perfect. Okay, do you have any, Felicia, that we haven't done?
Okay, so clean and disinfect entire nightstand. Oh, sorry.
Okay, so the entire nightstand, think about that, that means inside the drawers, inside
That's
the
a
cabinet.
discharge only. I do that on discharge only.
Isolation.
So they got personal stuff in there any other time.
Discharge only, because we would do it in discharge isolation also,
Yeah.
right?
Oh, yeah. Yeah, it's both.
Okay.
It's both.
Yeah.
That's right.
So both types of of discharges, we're gonna
Yeah.
do that, but not the occupied, we're not gonna be going through the rifle and through the patient's drawers while they're here. Okay, I don't have any left that we haven't done. Mo, do you have any that we haven't done?
Leave an EBS technician calling
Oh.
card.
Okay, so again, it's not something we necessarily always do here. We do have those while you were out, little Post-its available. And we can certainly, if you ever wanted, you know, we used to get you business
I
cards if you
remember.
wanted. So we can still get them if you'd like them.
I still had them. I still
Yeah,
got a
well, I
stack
want
of
a
them.
business card.
You want a business card? Let us know, we'll order your business card. Yeah, we have them, just
We
write
got
your name
some,
on
we got some big pieces of paper. They like,
Have my name on it?
Yeah, I'll put it on my
you put a
parking
name
lot.
on it for real?
Yes.
I thought we wrote our name on it.
Oh, we can order a card.
No, if you, we have printed, we have cards, we just put them in a printer.
Roswell,
Yeah, and then, yeah,
Yeah, we could do that.
and we can put your certification on there too, actually.
Yeah.
Do you have any other ones, Mo, we can do?
Oh, I got one. I got choose a specific disinfectant for the room.
Okay, when are we gonna do that? A specific disinfectant.
A specific one.
Right, because the other ones we use are standard. So really, it's gonna be that Contact Plus where we're choosing a specific one. The other ones we use are standard disinfectant.
Who else would be interested in cards?
I think I'm gonna take some too. I'm gonna try it. Yeah,
Yeah, I think our trainer should have credit.
Yeah,
that would be
we're
nice.
just gonna do it for all trainers.
But I don't want 50, please. Just like 25
You'd
maybe?
be surprised how, I think they only give you a minimum, but yeah,
Oh,
I'll
okay.
check.
Does anyone else have any cards that we did not review?
I don't have it.
No.
No? You good? Okay, well, you can pass those cards back down here. I think there's 3 sets on.
Yeah.
Why they give you 3 sets? Seems weird.
I used to be training class.
Okay, so let's see how we did, okay?
Oh,
And we can
okay,
write-
Here it is.
So where are the tasks, where is this task performed? Okay, so what this shows is in the discharge isolation room is don appropriate PPE specific to the type of isolation. Okay, so that would be correct. And you can write these down if you
Yeah, and
want.
your.
Yeah,
and your
write these
book,
down
I'll
in your
jot them
columns.
down.
Mhm.
Place privacy and shower curtains in the discharge isolation. Okay, choose specific disinfectant for the room.
Of course, yeah.
That's all right.
And I'll take some notes too, just because I know some people write faster.
But it won't be in your book then for future use.
At least you got it in the phone and you
Yeah.
can study.
I'll do it
Okay.
here too.
Yeah.
Okay.
So
He said that there's too much for writing.
Is it too much to write? Not that much, but that's fine. Sometimes writing helps with helping you remember it, because you write it down and then you remember it. So replacing privacy and shower curtains for the discharge isolation. Choose specific disinfectant for the room. Like we said, specific. All the other rooms, we're gonna use our normal standard one. Dispose of isolation waste appropriately. Perform hand hygiene. Disinfect all high-touch, horizontal, and other surfaces. And then check medical waste and sharps containers. Then under the occupied patient room, We have leaving the environmental services technician calling card. And again, that's really a thing that they're saying is designed really to kind of greet the patient early in their stay with. So if they have issues or concerns or questions during their stay, they can reach out and they can get some assistance. Greet the patient, family, and visitors and explain why you're there. Okay. Disinfect all high-touch surfaces in the occupied room. Again, remember we talked about that? I had a feeling that's what they were going to, key on. If you look at the occupied room, it says disinfect all high-touch surfaces. And you look at the others, it says all high-touch, horizontal, and other surfaces. So we do the high-touch in all of them, but in the discharges, we do all the surfaces. In the occupied room, we're gonna check the trash cans. Okay, again, we talked about that. I had a feeling that's where they were going with that, is you're not gonna necessarily empty it unless it's, unless it's full or has a lot of trash in it. We're gonna perform hand hygiene, and that appears in all 3 columns. And we're gonna check medical waste and sharps containers. That appears in all 3 columns as well. So I think we're pretty spot on these. Discharge patient room, we're gonna clean the mattress. Again, I don't know why that wouldn't be also under discharge isolation room, because you're gonna clean the mattress there too. Clean pillows, again, I would say that's under discharge isolation room. Remake bed with clean linens. Clean and disinfect entire nightstand. Move items to dust mop and mop under. Perform hand hygiene. Disinfect all high-touch horizontal and other surfaces, and check medical waste and sharps containers. So I think the gist of how they're laying this out here is, in the discharge patient room, we do all those things. Then in the isolation room, we do all those things plus those other, So the isolation room, we're doing all the things we would do in a discharge patient room, but then the additional stuff that we would specifically do for isolation. Like, privacy and shower curtains, pick a specific disinfectant if needed, dispose of isolation waste, and make sure we have the right PPE. We have those of you who are waiting a couple more minutes to get through that.
I noticed they gave us cards, multiple cards for ones that had going more than one column.
Oh, okay, maybe that's what it is.
Yep.
Didn't really do the column.
Yeah.
Exercise.
That's right, because some of them have done it, I'm like,
Yeah, like
Yeah,
the
that's
hand
what it is.
hygiene probably has 3. And,
yeah,
okay, that makes sense.
yeah.
I guess. Okay, we almost wrapped up. A couple more things to write. Let me know when you're done. Okay. All right, we good?
Got mine.
Okay, so we're gonna go over some of the steps involved in cleaning an isolation room. Okay, so turn to page 6.9 of your participant guide. And you're gonna see some steps for cleaning an isolation room. Again, reminder that you're looking at the discharge patient steps for an isolation room, but the guidelines, guidelines are just a little bit different for an occupied patient room, occupied isolation room. You're still gonna do the, the proper PPE for an isolation room that's occupied, but these steps we're talking about are for a discharge. Okay, and many of these steps are the same for all room types. It doesn't matter. We talked about that. So some of the differences, okay? Number one difference in going into an isolation room is, the very number one difference is reading the sign. Read the sign. Know what type of isolation it is, know exactly what PPE you need, and make sure you have it, okay? Make sure you have the right PPE. If you don't go in the room. The other thing to remember that's different with an isolation room, make sure you have the proper disinfectant, okay? For all isolations, it's gonna be our standard peroxide wipe, except for C. diff, which is a bleach wipe. Follow the facility policy, which in our policy for cleaning, removing, or replacing privacy and shower curtains is on isolation. We change shower curtain, we change the cubicle curtain. So call your manager, call Maria or whoever's on the patient tower that day, and they will instruct you, or they will get someone to change out the cubicle curtain. And again, that doesn't apply a ton to us on the patient floors because we only have so many rooms that actually have curtains, you know? A lot of our cubicle curtains, we don't have a ton of them. Like every room doesn't have them in the inpatient setting. There's probably, I think, maybe 50 or 60 total.
Seven's got 'em.
The 7's got them, the 6's got them, 5's don't have any, right? They're all privates.
Okay.
And the 8's, like 8 West has, every room has a cubicle on 8 West. ICU, every room has a cubicle. But I think on the 7's and the 6's, it's only like 4 rooms per unit that have them. So we don't have that many cubicle curtains because most of our rooms are private rooms. And then again, make sure you're using the proper steps for removing the PPE. That's a big point. You know, make sure you're removing it the right way. And then make sure, we talked about this the other day, make sure we are cleaning and disinfecting our equipment after we bring it out of an isolation room. That includes mop handles. That includes if you brought the whole bucket of wipes in, to wipe that off. That includes your Johnny mop and your holder, your caddy. Disinfect that after isolation. The Johnny mop itself, you throw
Oh,
away.
yeah,
I'm talking about the actual, like,
to wipe it down.
wipe that down. If you had it inside the isolation room, wipe it off before you take it out.
So that wouldn't be a part of at the end of the day?
I would do it, you know, you should do it when you come
Immediately?
out of as you're coming out of the room, you should do it immediately.
Immediately.
Because then you could take it into the next room. You know, you don't want to take it into another room without disinfecting it.
Oh, okay. I know
The
what you're
caddy,
saying.
the caddy. I'm talking
Yeah, oh, yeah, that's,
about. The actual bowl swab, you throw right in the garbage.
okay, that makes sense.
Yeah, but the actual caddy, you want to, any equipment that you brought into an isolation room should be wiped down before you bring it out.
Okay.
Okay? Okay, any questions on that?
Yeah, this is another one of those.
Oh.
I was wondering.
There we go, clean mattress. Okay. So let's talk a little bit about cleaning restrooms specifically in an isolation room, okay? And following this procedure is extremely important in isolation rooms because, especially with things like C. diff, because, you know, as we know, the bacteria or the agent that is the microorganism in C. diff is contained in the stool. And often there's, you know, diarrhea or others, you know, discharge that could be liquid or splattered, and it can get out everywhere. We've all seen it, you know. It's kind of gross to talk about, but we've all been there. We've all seen it. This is the world we live in. So we need to make sure we're very specific when cleaning restrooms in isolation rooms. Okay. How about if we identify on this picture some possible splash areas? Where do we think things could splash in this restroom? Specifically with someone going to the bathroom. The toilet, definitely, all parts of the toilet,
Yeah.
from the bottom of the seats
Seat all the way up.
to the underneath part of the bowl,
Yes.
the flush handle.
Yeah.
And that whole pipe, you know, the whole pipe's going up. Where else?
The mirror, the sink.
Yeah, the mirror a little bit, the sink. I always tell folks,
The handles.
yeah, I always tell folks, this part of the wall right here, right next to the toilet, is an area that we miss an awful lot. And when we do rounds, that's something we
You can't
rewrite it
miss
down.
that.
Yeah, that's something we write down quite a bit. It's just, I think people forget about it, but definitely when you're
Wow.
sitting on the toilet, stuff splashes.
I
okay?
know, but how do you forget about it? You see it. If I see it, you
We're
see
humans,
it.
and we forget things. It happens. Everyone forgets things. We do.
Okay.
I'm not saying it's malicious that they're forgetting about it. I'm just saying people forget about it. So, but these walls, especially right around the toilet, I'm not as concerned over here with, like, not that you're not going to wipe down the shower walls. I'm just saying as far as splashing and splattering from the toilet,
Yeah.
it's not likely to get that far. It
It even
could,
hits the
it
baseboard.
could.
You know, it
but-
gets to the baseboards
yeah.
too, you know.
Just again, think of it in terms of where could things splash or splatter, okay? So some examples they give are the sink surface, pipes, soap dispenser. We do get splash and splatter there, but that's usually soap that we get on the soap dispenser. Toilets
Rapid
and the
response,
seat, the
clinical
outside of
science
the
center,
toilet,
first floor, breast clinic. Rapid
walls and
response, clinical
partitions.
science
And
center,
again, if
first
it's
floor,
a
breast clinic.
closed-in bathroom
Rapid
where it's got
response,
the
clinical
partitions
science
around
center,
it, the
first
sides of
floor,
the
breast
partition
clinic.
walls. And obviously, remember, we're gonna clean the restroom when to avoid cross-contamination. When do we clean the restroom? Last thing, exactly. And then whatever cloth or towel, or it should be, your microfiber, or I'm sorry, your disposable wipe. Whatever is used to clean the toilet should definitely not be used to clean other items in the restroom. So don't clean your toilet and then go clean your sink with the same wipe.
Isn't that last? The toilet.
Should be, we always do, because and why is it last? Because we're cleaning,
Waste.
clean the dirty,
Yeah.
right? And what's the dirtiest thing in any patient room? Toilet. That should be one of the last things we ever do.
Clean to dirty. I gotta
Yep.
remember to say.
Clean the
that.
dirty. All right?
Clean to dirty.
Okay, so for C. diff, again, we're gonna use an EPA registered hospital grade intermediate level disinfectant with a label claim against C. diff, okay? For us, that is bleach, all right? You may have some slightly different requirements and this impacts how we clean the room. So during an outbreak, which we have had here, we had what they considered a C. diff outbreak here. It wasn't certainly of the size or scope that you would see in other hospitals because A, our patient population is much smaller, and B, it's a much more controlled environment. And we were able to kind of get out in front of it pretty quickly. But we had what was considered an outbreak back in 2015-ish of C. diff on a couple of units. And we basically were on full bleach cleaning on those units for almost a year. Probably at least, yeah, it was a long time. We have had little pop-ups here and there where they would see one patient, get C. diff, and then all of a sudden something else would pop up down the hall where another patient would get it. And typically, once they see a second, or definitely when they see a third patient in Roswell, contract C. diff, and then they actually send cultures out and they get the results back and they can see that it's the same strain, they will call us and we will go to bleach clean. We've had a couple instances where they've said, you know what, just clean the whole unit with bleach for a week or two and then go back to peroxide. And we err on the side of what infection control guides us. So our infection control folks are they're really on top of this. And all things considered, we have extremely low rates of C. diff and other infections here. But for that, we really follow their lead quite a bit. Okay, some other things to remember, some good practice when cleaning a toilet. Be careful not to splash, okay? Again, if you think you're gonna splash or splatter, safety glasses or goggles, but be careful not to splash the water all over the place. Allow the disinfectant, if we're putting it in the bowl, the yellow stuff, if that's what we're using to clean with, allow it to sit in there for a couple minutes because there is a dwell time associated with it. So not a bad idea to put that in even when you go in to run your water, because we run our sinks and our showers. When we go in to run our water, put the disinfectant in around the bowl and let it sit there while you're doing the rest of the room, and then come back and clean. That gets you your dwell time. Okay. Clean the seat surface and exterior areas of the toilet. Again, a lot of things we find are up underneath the bowl.
Yes.
Just things will drip down and kind of sit on the bottom of the bowl. Use the toilet bowl caddy and Johnny mop to clean the inside of the toilet. All right. And then we should be wiping the outside with a disposable wipe. Okay. After we're done with the Johnny mop, we're going to dispose of it after isolation, right? And then what are we using now? We're using one for every room. How are we doing to that?
We do that.
Yeah, I think after every 3 rooms.
After every 3 rooms, we're throwing it away, or if it's in isolation, every room. Okay. Yeah. I don't know.
Every 3 rooms?
Well, around there, when it gets to the
I
point of
just-
soil.
Yeah, sometimes I just throw it away.
We're not
Because
No,
I'm-
it's not set, you just.
We're
don't-
not gonna nickel and dime you on those,
Oh, okay.
we'd rather but don't use it for the entire day, one Johnny mop.
No.
Because they're cheap and we'll order
Yeah.
cases and cases and cases of them, we don't care. We'd rather have people be safe and infection
And
free.
is it okay you want us to use the yellow peroxide or Can we use the lemonades? Cause I heard you say
If
yesterday.
you
it
have
was
tough stains on there, you could use Lemonese. Lemonese isn't really a disinfectant. That's the only problem. It's just a cleaner and
It's abrasive
and it's got some abrasive into it. So if you have a stain or something that's in a toilet that you can't get out, you can certainly try some of the Lemonese. It shouldn't be your primary cleaner though, because it's not a disinfectant. It's
If
just
it
a,
sparks on your clothes, it instantly takes the color away, so it'll bleach your.
Lemonades?
Yeah, it's like super strong.
Really?
Oh, yeah, we
I
used to,
got it
remember
on-
at the
that
Highway
might be
we
those
hated it.
little specks that be on
It would drop on the carpets and destroy the whole hallway carpet. It was a nightmare. It was great to use, but
yeah, you just gotta be careful with it.
yeah.
And remove your gloves and discard after cleaning the restroom. Okay, again, that's why we do it last thing. All right, we should wear gloves, perform hand hygiene. And then again, you want to make sure you're keeping an eye on those walls, the back wall, the wall next to the toilet, to disinfect any splashes that get there.
In the, bottom, the side, what do they call them?
Baseboards?
Baseboards.
Yeah, the code base.
Because they,
Yeah.
they go underneath the baseboard.
Yeah, they sure do. So make sure we're wiping those as well. Okay? So any questions on isolation bathroom cleaning, isolation room cleaning? Okay, why don't we take a 5-minute break, restroom break. I'm gonna try and get this video queued up. And then we got another pile of cards that I think we're gonna try and go through and make sure we have everything we need.
Does anyone need to know where the restrooms are on this floor? Yeah.
Yeah, no,
Well,
over
you
here.
know where they are? Okay. Nope, I got it.
Get through.
I want to take a picture of that.
Of what? What do you want to picture?
That one that you showed.
This one?
Yeah.
Okay.
Just in
If you
case.
come over here, Becky, it's a little bit easier to get a picture of. I'll flip flop with you. Because that's on a small screen.
Oh, okay.
So I'm glad they put that, I think it's on some picture, then when it came out. I got anybody beside me. I'm trying to go that way.
There it is. She said, oh, no, that is. Here it is.
This is the one I want to check out.
Did I move too fast?
Yes.
Let's see, all right. Just did it. I got it. I can widen it and everything.
Yeah, that's a good thing.
Yeah.
Yeah. Easy for me because the way I have them, they'll be in order.
Mm-hmm.
Post my book and then I can go.
Yeah, there's only a couple
These are different floors, right?
Couple of users, yeah.
Yeah. I was looking through the book, you know how, you guys probably have one, but how it doesn't have a, index. You know, so I can't like look in the beginning and say this is on page so I can go right to, like the.
Oh,
Mode
right to all
transmission,
of
so
the
I'll have-
information.
Yeah, I looked at
Oh,
that.
yeah, did
That's
you
what-
find it?
No, Sam, it's.
It's not in
no,
here?
They may have one, it is.
There's a table of contents. It doesn't list each
See, that-
page,
yeah, that's
but
what
it gives
I'm
the
saying.
the
Gives the
modules.
Oh, yeah.
It gives each
Let me see.
module.
What number is
It's,
that?
1.4.
Yeah, I gotta put that, okay.
Okay.
Gives the full list of each module.
That's.
Oh, yeah.
Oh, yeah, I can see
Yeah, I see it. That's a good idea. I'm even gonna put this, highlight this,
That's what I was
and I highlight it. Yeah,
gonna say.
the weekend, I'm just gonna study.
Yeah.
My, sister-in-law helped me yesterday. She asked me a couple of questions. I had to answer them. She said, that doesn't sound like a good answer. So I had to say it the proper way. She started clapping on the phone.
Keep in mind, like we
I said, I'm
this is-
trying to learn how to talk. She said, you can do it. Just think before you start coming out of your mouth. Just think.
So, Carol meeting today at noon.
Oh,
Supposed to be 8:11:30, so I'm gonna go at 11:25 or so.
okay,
Sign off to you guys and then
sounds good.
I used the bathroom before I came. I was like, why am I going? Yeah, I should go around the room and do that. That sounds good. Just to do that, so I got all references of what I'm doing. Yeah. No, I don't got storage on my phone like that. I wish I could. Gotta think about, I gotta erase stuff. They gotta worry about no here? I'll wait first. Yeah.
this video. Says selecting. More than one video in section 6. Yeah.
Oh, I can't even see those numbers through. I have to move it up. 6 only has one. Maybe they wanted us to play it twice.
And I didn't watch it because I was out in the hallway. What was it about?
Just disinfect, choosing
Complete
disinfectant.
patient
Oh,
room, you must
okay.
first select
So, but that was the first one I was supposed to.
Yeah, that was, wasn't it?
Okay.
They have it, what, to start.
We could go back to 57 for lunch, so
Okay,
then we don't
thank
have to bring the food over and finish up there. Because I checked the thing and the meeting was canceled, they only have one from 10 to 11. Yeah. I'll have Maddie just, and then she doesn't bring lunch there, here. I'll just have her book it though. But I was like, oh, it's canceled, I was like, okay, but,
Oh, I see what we did. So the first video I was supposed to play is the video we played like the first day about the chain of infection.
no, you didn't click the one at the top of the screen, no?
I know, but I was supposed to.
Oh, you were?
So
Oh,
it
that's
says,
what-
click
okay.
to start the chain of infection video, which we watched already the first
We
day.
did, but they probably want us to refresh. Oh, well, we'll just play the refresh one now.
Yeah,
Because you already saw the disinfectant.
right. That sounds good.
All right,
We're getting it.
we'll get there. I mean, it's a lot of repetition, but it's because the stuff is that important.
Yeah.
Repeat it.
I do got a complaint, Alicia, but I don't wanna talk about
Suzanne,
it.
oh, good, you're in the office. Can you book room 257? The afternoon meeting was canceled, so we're gonna move back there starting at 12. Oh, you go into your calendar and book a meeting. Did you go to book or request or send a meeting request? And then just put location, click on locations. And you scroll down. And click on 257. Starting at good. And then put it from 12 to 12 to 4. Yes. And then you should get a confirmation. It'll say tentative, and then it'll say booked or something. It'll come through to your. Great. Game over. Okay, thank you. Can you just let Maddie know we'll be back there for lunch? Okay, thanks. All right. We're good?
You need anything?
No, not a little. What were you saying last time?
Oh, no, I did have a complaint, but I don't, I'll wait and talk about it later. When I come back to the floors, because I shouldn't be able to come back to the floor and have that back, people telling me that their room didn't get clean. I mean, as soon as they see me, come on.
Oh, this happened like yesterday?
Yesterday and the day before. And I'm trying, I did 4 rooms before I left.
Oh.
Because they complained and I didn't, and like you said, should you accommodate them? Yes, so I accommodated. So that's why I was a little late coming down,
Yeah.
because I was trying to accommodate everybody, and then the one guy messed his, soiled his clothes, and he wanted them washed, and so.
We're gonna get started. I don't know what Mo's doing, but,
Oh, he's making coffee.
you know,
I know.
he's grinding the beans or what is that?
There he is.
There he is. Yeah, we're gonna send out a search party, Mo. All right. So we mixed up the videos. So the one you watched the first time was the one we're supposed to watch now, but choosing disinfectants. But I guess we were supposed to replay this chain of infection video. So we're gonna replay that.
To prevent and control infection, first we need to understand how infections spread through the chain of infection. The chain of infection is made up of 6 different links. Infection occurs when each link is present in this order. But the chain is easy to break. Each link can be broken, which prevents disease and keeps patients safe. Let's go through each link. An infectious agent is an organism having the ability to cause disease.
Whoa.
To break this link, seek prompt treatment if you are ill and use the right cleaning solution to disinfect the pathogens you have identified. The second link is a reservoir. A reservoir is where pathogens can thrive and reproduce, like tabletops and doorknobs and people. Break this link by washing your hands, keeping a clean environment, and disinfecting surfaces. Next in the chain is the portal of exit, which is how the pathogen leaves the reservoir, such as sneezes or coughs. Break this link by wearing personal protective equipment, washing your hands, properly disposing of trash, and covering it safe. Let's go through each link. An infectious agent is an organism having the ability to cause disease. To break this link, seek prompt treatment if you are ill and use the right cleaning solution to disinfect the pathogens you have identified. The second link is a reservoir. A reservoir is where pathogens can thrive and reproduce, like tabletops and doorknobs and people. Break this link by washing your hands, keeping a clean environment, and disinfecting surfaces. Next in the chain is the portal of exit, which is how the pathogen leaves the reservoir, such as sneezes or coughs. Break this link by wearing personal protective equipment, washing your hands, properly disposing of trash, and covering your cough or sneeze. The fourth link is the mode of transmission. This is how pathogens are carried from one place to another, even on the hands of a healthcare worker. To break this link, wash your hands, control airflow in negative pressure rooms, disinfect surfaces, handle food properly, and observe isolation precautions. Next, the chain includes the portal of entry. It's the way pathogens enter the host, like breaks in the skin. Healthcare workers break this link by practicing aseptic technique during procedures, taking proper care of wounds, washing their hands, and properly caring for catheters. The last link in the chain of infection is the susceptible host. The host is a person who cannot defend against pathogens, such as the elderly or burn patients. Healthcare workers break this link by treating the primary disease and identifying those at higher risk for infection. As a healthcare environmental services technician, you can see how your daily duties give you many chances to break the chain and keep everyone safe from illness.
Okay, so again, great refresher. We'll probably watch that, I would think, even again before this is all over, because it's just that important. I mean, a few points there. Number one, it's important for us to really know that we have a huge role in potentially breaking that chain of infection. Any one of those links in the chain, if we are able to break it through proper disinfection, through not moving things from one room to another, by using the right chemical and the right process, and make sure we're hitting high touch surfaces and all those things that we do every day, we break any one of those links in the chain, and all of a sudden other people aren't getting sick. And we don't have a C. diff outbreak, or we don't have people come into the hospital for surgery on one thing and leave with something else. Okay, getting a hospital acquired infection. Uber important. I mean, the weird thing about that is victory in this case, victory in the case of infection control is nothing. Nobody gets hurt. No, you don't hear anything. You know, if you don't hear that people got an infection, then you won. You know, and so it's hard to kind of quantify that, but we do look at, and infection control does run numbers on post-op infections and things like that, hospital acquired infections. And, you know, typically our numbers are very low, and a lot of that's because of the great work that you do every single day. All right. So next we're going to get into talking a little more in detail about waste. Okay. So we're going to identify some waste streams. So I did go through these cards. So these take, everyone you take like 3 or 4. 3 or 4? Say 5. Let's go 5 again. I think I got all of them sorted so we don't have repeats, but if we have repeats, we have repeats. So we're going to kind of talk about 4 different categories of waste. Okay. Some of these, I guess, could be, and we'll talk through kind of how we handle it here at Roswell, but kind of we'll talk through kind of which pile, which kind of segregated waste pile or waste stream each of these types of waste goes into. So the piles we're dealing with, or the 4 categories, are going to be solid waste. And that's just like kind of clear bag, you know, clear bag trash or municipal waste.
That's
okay? The recyclable waste, which are things that we recycle, could be in a lot of different categories. Hazardous waste, and hazardous waste are things that typically fall under OES's
So that's red?
purview. Well, hazardous are things that fall under OES, occupational environmental safety typically, and then regulated medical waste is the red. But there's also things under regulated medical waste that are not red, okay? So there are things that are, like chemo is considered a regulated medical waste, but it's not red, it's yellow. You know, so regulated
It
medical,
wouldn't be a hazard?
well, they're all hazardous, but hazardous typically refers to things that are like chemicals, more chemical waste. So we see that, and we'll get it as we go through the cards, you'll see what I'm talking about.
Okay.
Okay, so Mo, what's the first one you have?
Formulation.
Formalin?
Yeah,
Formalin, okay, so formalin, does anyone know what formalin is? Okay, so anyone who's worked in pathology ever, you see like little jars of things with like body parts and stuff
Oh, yeah,
floating in it. Okay, and it smells really, really strong, and if you got a whiff of it, it almost knocks you out. So some of the section rooms, like there's a section room up in the OR next to endoscopy. They do some stuff with formalin in there. There's a room in, is it derm? There's that one little lab section room
Oh,
in
yeah.
derm where they use a lot of formalin. Formalin is a chemical waste, okay? It's a really strong chemical that is typically used for storage of pathological parts, like body parts, or say they do take something off your skin and they're sending it for cultures, they'll store it in formalin, okay? So formalin is a liquid chemical waste. Where do you think that would go as far as when we get rid of it?
Regulated medical waste bag.
What's that?
Chemical, he said chemical.
Have you ever had to handle it? I'll give you guys a little hint. Things that we've never had to handle typically would go into hazardous waste.
Oh, that's.
Right? So formalin would definitely go in the hazardous waste category. That's something that, like Bobby, do you guys know Bobby from pathology?
Yeah.
He handles a lot of the formalin, and when you see him with those gasoline jugs,
Yes,
those
yes.
red jugs full, that's typically formalin that he's dealing with. And he deals with transporting and disposing of that. That's a hazardous waste, okay?
Mine's
Becky, what do you got?
pellets, Pellets.
Pellets? Okay, what do you think pellets would fall under?
Isn't that like?
Recyclable one.
But this.
Solid waste.
Pellets are those wooden things that all our
Yeah,
supplies
that
come on.
all supplies come on.
Yeah.
Why would we be handling?
What do you think, where do those get disposed of?
Oh, I seen them before. I seen them
Yeah.
downstairs, but, they recycle.
Yeah.
Sometimes.
I
We
seen them.
do, we
I seen
recycle
them. I
them.
seen them.
So Bob actually has a big part in that. We stack them up and then there's a guy comes with a truck and picks them up and actually recycles them and reuses them. So yeah, pellets are recycled. Kapil,
I have body fluids.
body fluids? What do you think about body fluids? That could be blood, that could be urine, that could be any fluids that come out of the body. Suction containers,
Regulated medical waste.
regulated medical waste. Yep, those typically the suction containers, things like that, they go into the regulated medical waste stream. Yep,
What's that, body waste?
body, yeah, body waste, body fluids. Okay, Wanda, what you got?
It's packaging.
What is it?
Product
Packaging.
Oh, product packaging. So like, you know, it looks like food, like a paper, potato chip bag or something like that.
Plastic wrappers.
Yeah, That's solid waste.
Garbage that we throw away every day is
Yeah,
solid.
solid.
waste.
Yes, clear. That's it.
Regular, clear municipal waste, yeah, is solid. I will tell you that all of our solid waste here at Roswell,
What's that called again?
product packaging.
Potato chips.
So the reason you're not gonna recycle most of that is because typically it's soiled in some way, so they won't take it as recycling. So if you got a bag of potato chips and you say, oh, well, it's plastic, so I can put that in recycling. Because it's got food on it and it's dirty, they won't take it as recycling.
So it goes in clear.
It goes in regular solid waste. I will tell you, all of our solid waste here at Roswell, we have a contract. We use Modern Disposal. That's our waste provider. And they take all of our waste by contract up to a place called Covanta. Covanta is up in Niagara Falls, and it is what they call a cogen plant. They take all of our waste, they burn it, and then they use the steam from the burn to move a turbine and generate electricity. So, and then they feed that electricity back into the grid. So essentially, all of our waste is recycled in some way.
It's
Okay,
recycled.
so in some way, all of our waste here at Roswell is recycled, even if it goes into the solid waste stream. That's one reason we don't run around collecting bottles. Because A, we don't have the labor to do it and the staff to do it. And B, even if it gets thrown in the garbage can, it gets turned into electricity. Because we burn it and turn it into steam. And that is by our contract, it is mandated that they take all of our trash there. They have other sites that they could take it and landfill it, but we have mandated you absolutely cannot take ours there or we're not paying for it. All right, so we really want to make sure we're mindful of our carbon footprint and that we're doing the right thing with our waste. So for all of our solid waste, it gets turned into electricity. Just so you know. It's not really relevant to this class or to this or to the test, but just so you're aware. Sure, yeah.
I definitely would like to know where we put broken furniture.
Broken furniture? Okay, where do you think we put broken furniture?
But, well, it'll go in recycling, wouldn't it?
That's not what depends.
I would say that depends. So broken furniture, a few different things happen to that here.
Yeah.
Sometimes we will try to fix it and recycle it and reuse it, okay? But if it's broken beyond repair, we typically, if it's metal, if it's mostly metal, we recycle it. We have a metal dumpster.
But if it's
Yeah.
wood,
If it's wood, typically that would go in
Recycle?
just in solid waste.
yeah, so that's what I'm like.
Yeah. Typically, if it's just like a couch or something like
Yeah,
that,
like one of these chairs.
one of these chairs, there's not enough metal on this chair to really make it
When they
worth
throw these
it.
chairs away in the dirty living room, whose job is to get them? Cause
And
sometimes.
the soil
It's
room?
ours.
Cause
ours?
I tell y'all, I tell Eric, cause sometimes they be sitting there for a minute.
Yeah, usually we wait for someone to put a sign on it that they're garbage.
Don't nobody put a sign on it. they just
I got one
throw
at
it.
a time, one at a time, one at a time. So the answer, Mo, is that if it's in the soiled room and it's trash, we pick it up and throw it out.
So
So,
I tell Eric, and.
yeah,
you
we'll
know,
take it
put
out.
For a minute.
Just let Maria know. We'll get it pulled out. Sometimes he's just got full
Because
bins. in it.
sometimes he like, I ain't my job.
And if he's got a full huge bin, he sometimes
Yeah,
can't fit it.
I understand, but.
Yeah. Well,
Sometimes it be taking up a lot of room.
Yeah.
And they start packing other stuff.
and those rooms, like we talked about yesterday, those rooms are tiny. So, yeah, we'll get it out of there. And sometimes it's Bob or Chris or someone else is free, we'll have to come up with a
What
platform. and take it.
platform do we go on? The one by the dietary or the one by us? The chair.
Well, sometimes they just
So-
throw it away.
But you
They
put-
put-
no, you
they
put
put-
it on the
It does
platform.
not, it does not go into the compactor where the
See?
trash goes.
Told you.
It goes into a
I was
dumpster.
just talking about getting it on the floor. I
Oh.
don't care where it's going for that. They just get it on the floor.
Yeah, we have dumpsters out the back by the dietary dock. There's some different
Yeah.
construction dumpsters and we would typically throw it in one of their large items. We throw in there. You can't throw them in the compactor, it'll jam
Okay,
up.
thank you.
Okay, all right. I have broken furniture. Pharmaceutical waste. Again, we may get some repeats. I thought I got them all out, but pharmaceutical waste.
That's medical.
Pills, things like that. Yeah, typically it's medical. It's not something we deal with. So it does kind of fall kind of between that hazardous and medical waste pile. I would say since OES and pharmacy really handles the pharmaceutical waste, we don't really touch it or get anywhere near it. It would be more on the hazardous side. Because there used to be like, if you had waste, like if the nurses had like extra medication in the syringe, they would waste it down the drain. They can't really do that anymore. They have to put it in a special
Yeah,
container.
I've seen it.
So it's kind of falls
Seen
more in
it.
the hazardous pile than it does the regular
Oh,
medical waste
okay.
pile. Okay, Mo, what you got?
Aerosol cans.
Aerosol cans. What do you think of those? What do we do with aerosol cans?
Aerosol.
What do you like?
If they're empty, completely empty, I get, they can
Can they
go
go
in
in
solid
the
waste. Most times they would be a hazardous thing because especially if it's like
We would probably
propane.
throw this in the garbage.
In a regular garbage.
Yeah, as long as it's completely empty, you know, because if it's completely empty, there's no gas, no compressed gas left in it, then yes, it can go in regular solid. If it's got gas left in it of any kind, it should probably go to hazardous. Okay,
Okay, mine's is paper.
paper, what do we do with paper here?
Recycle.
Recycle, yeah,
I thought they don't recycle.
they do.
That's what they said when I do the blue bin. We don't have a recycle thing in our dirty soil room.
Okay,
And we used to have one a while ago. It's been 2 years I haven't
so
seen
we
it.
absolutely recycle. When Chris and
Chris,
Anthony and them come
Yeah,
up.
Yeah,
they
I
come
know
and
they
take
come
it.
and get that, but that's private stuff that they recycle.
And regular recycling too. It all goes into, we recycle all
Do they
of it.
know that? Do they know they're supposed to get it out of the
Yes.
recycle No, little garbage can.
No,
They ain't getting out
we
the
don't
middle.
go to little car, no, they don't go,
Oh.
they get it out the
The
big.
big blue
No,
bins.
no, that's why I told everybody we don't recycle.
We absolutely recycle.
We don't do the
That's
garbage,
fake
don't throw away
news.
every
We
day.
absolutely recycle.
But not cans.
It's the
Not-
blue
not
one,
cans.
the blue one.
We recycle paper
Yeah.
and cardboard. But not cans. No, we're not chasing people around for their top cans. Absolutely not.
Okay.
But paper, yes. Cardboard, yes. We do recycle. Okay.
Battery, right?
What's that?
Battery?
Batteries, some batteries, yes, we do recycle. Mostly the ones from like the workstations on wheels and stuff like that. We do recycle batteries. We haven't gotten to that card yet, one. We'll get there.
Paper towels.
Paper towels. So
Solid waste.
this typically would go into solid waste. Yeah, we're not gonna chase every paper towel that gets used and try to recycle it. And most of our paper towels come from a good percentage of recycled paper anyway. And once you've recycled paper once, you can't recycle it again. So because the paper towels have already come from recycled material, they go into solid waste. Mondo, what you got?
Trade, chemotherapy. Chemotherapy engine.
Okay, trace chemotherapeutic agent. This is an interesting one because several years ago, there would have been a separation between trace chemo and bulk chemo. So back when chemotherapy, the chemo infusion was down in where our main lobby is now. Anybody remember those days?
I remember those
When
days.
Chemo was way down there.
I know.
Back then, trace chemo waste would have gone into just regular garbage. So if they were wearing one of those gowns and they got just like a little splash or something on their gown or their gloves that they wore while administering chemo, would have gone into regular solid waste. They changed that ruling, I want to say in 2018, 17, 18, around there, so that any bulk or trace chemo has to go into the chemo bin. So when that happened, our volume of chemo waste went through the roof. And we pay a much higher price to dispose of it than we do solid waste. So we weren't thrilled about that, but it's really to keep everyone safe and make sure chemo is not getting out there into the world and just being stuck in a landfill somewhere. So anyway, bulk and trace chemotherapeutic waste now go into the regulated medical waste. Okay? Dorita,
Pizza box.
pizza box. So you think you recycle a pizza box?
No.
Why?
They got a food.
It's got food on it.
No.
Okay, if it's dirty and soiled and greasy and
So
got
it's gonna
food,
go into the
they will
solid.
not accept it. It's solid waste, yep. And again, similar to the paper towels, if it's already come from a good portion of it, creating it being previously recycled, they can't recycle it again. So if your pizza box is at home, they should go into the solid waste because they have food on them. Okay? I have, my turn. I have the bulk chemotherapeutic
Okay.
waste, but we talked about that. That goes, bulk chemotherapeutic waste goes into the regulated medical. Food or food scraps, solid waste. Yep, solid waste. There are some programs out there that try to compost it, and that would be a form of recycling. So some kitchens, there are some things in the kitchen that they try to compost, whether it's not necessarily the containers, but the actual food itself, the proteins. They can kind of compost them and turn them into like soil to grow crops and things like that. So some hospitals and other places have programs for that. Ours is not very well developed. So food and food scraps for us goes into municipal waste or solid waste. Oh, what you got? Fluorescent lights. Now, I will say that Roswell has moved away from most fluorescent lights. We have a lot of the LED type lights, which last a lot longer and don't have to be replaced. But we don't really have a lot of fluorescent lights left on this campus. But if we do have them, what do we do? What happens to them? Do you know? When maintenance changes them out.
I don't know if they recycle.
They actually do recycle. They have a bulb crusher and they go into a bulb crusher and then they take the glass and that gets recycled. So yeah, that would go in a recycle pile. Okay, Becky, what you got?
Oh, and I got motor oil.
Motor oil. Okay, well, you know what happens with motor oil, right? You get the oil in your car changed, what do? They recycle it, yeah.
Recycling.
Yeah, they recycle that. Motor oil gets recycled. And actually Roswell in their generators and stuff has quite a bit of diesel type oil and they recycle that as well. Okay, Kapil?
I have print cartridge.
Print cartridges. Okay, what do you think we do with those?
Oh, I'm having a hard time with
Solid
those.
waste, I think.
Solid waste, those actually do get recycled. They're supposed to get recycled.
Yeah,
The
but
companies that manage the copiers are supposed to take them when they come to do their PMs and repairs on the copier machines.
I saw always in the trash.
I always see it in the trash too,
I
and I
know
don't know what
because
to do.
I don't know that our program is as robust as it should be for them actually coming to get them. So they stack up and stack up and stack up, and then people just get sick of looking at them and throw them in the trash. But they can and are recycled here. Just probably not all of them.
Okay.
Okay. What else? Who's next?
Body part and organ.
Body parts and organs. Where do you think body parts and organs go?
Hospital.
What's that? They're not hazardous. No,
Wow, that would be better.
regulated medical, yep. They go in regulated medical under a category basically that is pathological waste. Okay, so under regulated medical, there's essentially, well, there's pretty much 4 categories. There's chemo, there is regulated like red bag or blood and body fluid, okay, red bag waste, and there is pathological waste. That would be your body parts. The 4th one is like your sharps, okay? So those are really the 4 categories. Your red bag waste, like blood and body fluids, your yellow stuff, which is the chemo, and then your body parts and pathology. We get quite a bit from pathology here, and we also get quite a bit from DLAR, a lot of pathological animal parts and waste from different experiments that things are doing. So we get that here, and it actually has to stay frozen in a freezer until the morning when they come to pick it up. So Bob goes around and picks all that stuff up every week from DLAR and from all the labs that have pathological waste. And then again, he works with Bobby in pathology to get any of his path waste. But there's pretty specific guidelines for how that's handled, how it's boxed, and it's a big thing that Bob deals with actually. Okay, Sharita.
Plastic wraps.
Plastic wraps.
Yeah, plastic
Okay.
wraps. So that's basic.
Yeah, we typically here, we'll put that into, we don't really recycle the plastic, the wrappings that go around pallets. We throw that pretty much into solid waste. You know, if they have a pallet that's wrapped around in plastic. I have lab specimens.
That's medical?
That's regulated medical. Yeah, that's gonna go on medical waste. Yep, the stuff we picked up from the labs. Oh, you got anything we haven't done yet? Xylene. Yeah. So xylene is similar to formalin. You got all the good ones, Mo. Xylene is very similar to formalin. It's used in similar ways. It's the same type of thing, used a lot in pathology, but it's definitely a liquid and very strong smelling, can knock you on your butt. When I was a young person at Kenmore Mercy, ES was actually in charge of the xylene and formalin, and we would have to collect it from the labs and take it in those little jugs and dump it into a 50-gallon drum with a full respirator and everything on. And I was there one time when a thing of xylene spilled and they had to call in the DEC. They shut the whole loading dock down. They had all the guys in the hazmat suits, and it's pretty nasty stuff. So yeah, xylene would go under hazardous, definitely hazardous.
And I got toner cartridge.
Yeah, we already did those. That was supposed to be recycled, doesn't always happen. Any other ones that we haven't done?
I have cardboard boxes.
Cardboard boxes. You know, we recycle those. We have an actual compactor for them, outside the loading dock, outside Chris's shred room, is where our cardboard compactor is.
And I have one question. I get the plate, like a glass plated, right? And then glass.
Glass, like broken glass?
Actually plate, like a glass plate, and then
Okay.
ceramic cups.
Okay.
Where I can throw this?
I would throw those in a construction dumpster. We're not gonna recycle those. Those would go in one of our big open ties, so it'd be solid
That's
waste.
somebody that threw away the glass and cup.
Yeah, solid
That's
waste.
awesome.
Yeah, just, if it's glass or it could break, I always tell people, put it in like a cardboard box or something to protect it so someone doesn't slice themselves.
Oh.
Any other ones we don't have? Needles and sharps, yes. Where do you think needles and sharps go?
Yeah, the medical part.
Regulated medical, yeah, that's another category, of regulated medical. Rita, you have any we haven't gone over?
Plastic bottles.
Plastic bottles, so
That we don't
while
recycle.
we do not go around recycling them, they are recyclable.
Yeah.
So there are 2 places on campus where people, if they so choose, can bring their bottles to be recycled. There is a bin inside the cafeteria. It's a big
Yeah.
red, square bin. If they want to throw their bottles in there, the cafeteria will gladly recycle them. And there's actually one of those same kind of bins over in the CGP. There's a recycle bottle recycling bin in CGP. Those are the two locations on campus where we have bottle recycling, but we don't manage it. It's done through the kitchen and they work through that program. But so if you really want to recycle your bottles, bring them to one of those two places. I tell folks all the time when they call me and say, why won't you pick up our bottles? We will, but we're gonna throw them in the garbage. They're gonna get recycled and turned into electricity. If you want them to be reused as plastic, then rinse them out, make them clean and take them to cafeteria or CGP. Okay? All right, so let's look at the list here and see how we think we did. So under solid waste, we've got food or food scraps. Again, some people will try to recycle that through composting. Used paper towels, like I said, can't recycle those. They've already been used and they probably already come from recycled materials. Pizza boxes, product packaging, plastic wrap, plastic bags, and broken furniture. Again, for us, if broken furniture is mostly metal, we will recycle that as well. Like beds or IV poles or things like that, we'll throw them in the metal dumpster and recycle those. Recyclable waste, paper, cardboard, plastics, some plastics. We don't really do a lot of plastic recycling, actually. Pallets, toner cartridges. Hazardous waste would be the pharmaceutical, the formalin, your xylene.
Oil was recycled.
Well, if you don't recycle it, it's hazardous, I guess, but we recycle it. So I guess it could be hazardous. And that's why we have to get it into the hands of someone who will recycle it. So we don't actually do the recycling. We will have like a company come in and take it. Similar to if you change your oil at home of your car, you can take the motor oil to a garage and they have to take it because it's considered hazardous. You can't dump it down the drain. You can't just throw it in the garbage. You actually have to get it, but then they recycle it. So I guess that's kind of one that falls in between. It's a hazardous substance, but it can be recycled. Ballasts, I didn't see that one come through, but ballasts, we don't really deal, again, we don't have a lot of lights that have ballasts anymore because we got away from the fluorescents. Batteries are considered, again, hazardous if you dispose of them in the garbage if you don't recycle them. Like the little batteries that we have in our dispensers and things like that, we don't recycle all those little household batteries. We do recycle the little cell batteries that we get out of the WOWs and the ones we get out of our machines, like our auto scrubbers and stuff. Aerosol cans can be hazardous if all the gas is not out of them. And then bulk chemotherapeutic waste. Again, this falls into the chemotherapeutic waste falls into the category of it's bulk. I guess what they're considering bulk is like if you have a big tank of it. All right, we don't really deal in amounts that large. Ours are much smaller amounts that we deal with. So that would fall under regulated medical. Under RMW, sharps and needles, body fluids, human parts or animal parts, specimens from the labs, pathological tissues, organs, body parts, body fluids, cultures and stocks, and trace chemotherapeutic waste. Any questions? And some of this is stuff we deal with every single day, some of it's not. Some of it's things that other departments deal with. But it's just good to have a working knowledge of what we do and what we try to stay away from. Okay. So now that you know the difference between different types of waste, let's look at some rules for handling certain types of waste. Okay. Employees who process, package, or dispose of regulated medical waste.
Yeah,
There is. Your whole grid, it's in your book. See, it's different in my book. I gotta keep flipping back and forth. Yeah, you got them all listed. Yeah, me too. You guys don't like writing, do you? You got a thing against writing.
Oh, it hurts your head.
It helps you learn.
I know, it really does.
It helps you learn.
And for me, that helps me learn. I don't forget what I wrote.
So yes, it is in the book. The grid is in the book. Okay, so now that we've talked about that, it's good for you to know that employees who process, package, and handle regulated medical waste, infectious substance, whether it's red bags or sharps, are considered hazmat employees by the Department of Transportation. Okay, So this means if you load, unload, or handle hazardous materials and or may prepare them for transportation. So we have a number of folks in our department that are hazmat trained, that are trained on DOT certification for handling of medical waste. Mostly that's our leads like Bob, Chris, and, you know, Luke either has or will be getting the training since he just moved over to the senior position. All of the managers are trained and DOT certified. And we really do that based on the fact that those are the folks that could sign the manifest. So when they come to take our medical waste, they give us what's called a manifest. And that manifest document has to be held by us for 3 years to track basically where the waste started and then where it ends up. So when Stericycle comes to get it, they fill out this manifest and says you have, 500 pounds of regulated medical waste. And then they give us a copy of it. We sign it. They take 4 other copies with them. One goes to stays with them with Stericycle. One goes to if there's like a weigh station that they have to weigh their truck at. And then one will go to the final destination and stay there where they process it and bury it or burn it or autoclave it, whatever process they're doing to the waste. And then they send us a final copy back. And then we have to match up those 2 copies, the original copy and the destination copy. We have to match them up and hold on to those records for 3 years. We have and Steve actually in our office handles the kind of matching up the documents and keeping those organized. And then anytime Department of Health comes, Joint Commission comes, any of the regulatory agencies come, they ask to look at that document. And they do it regularly. I mean, every year I sit in a meeting. We'll be doing it here soon because the lab is going through their Joint Commission survey here soon just for the lab. And when they do, they're going to call me and say, we need to see your waste manifests. And I'll have to sit with them and go through and make sure they all match up and make sure that we have all our stuff in order. So in order to be able to be qualified to do that, you have to be DOT certified. And that certification happens every 3 years. You have to be recertified. And it helps you understand the major categories of waste that require special handling disposal, from lab waste to bulk blood and bulk blood products, pathology waste, sharps, bulk chemotherapeutic, engineering waste, recyclables. It gives you kind of a full scale view of the waste streams.
And that's for the whole hospital, or is that just for?
That's for the
different
entire campus. So anyone that handles that type of waste and packages it, meaning like boxes it. So Bob goes down and he boxes all that and marks down what's on it and puts the sticker on, labels them. Anyone who does that has to have that certification. We can't just throw anyone down there in that room and have them do it, or we'll get in big trouble. Doesn't mean we can't have people go up to the floors and bring it down to the room.
Yeah.
So every one of our internal waste transporters does not have to have that. But if you're packaging it for movement outside of our building, you have to be certified to sign off on it.
Besides Bob, have we got anyone else?
Chris, local have his soon.
Okay.
All the
I'm
managers.
saying, if he retires, what's gonna happen?
We're trying.
Every lead
has it.
Every lead employee has it.
Yeah, every lead
Oh,
employee gets it.
okay.
We put them through it. So we have the test booklet and we can get them the certification. So we can actually lead them through the training, much like we're doing here.
Yeah.
Just to have it. When it's a lead, we get that training for them. Okay. So if you're ever down in the waste handling area and the Stericycle guy comes and asks you to sign the manifest, don't do it because you don't have the certification. And he won't ask because he knows he has to either get Bob or Chris or come up to the office.
Then we have to add, they have some questions to add.
Yeah.
On there.
Yeah.
Fill in the
They have to
blanks.
fill in the blank.
Okay.
Yeah, we gotta fill in the blank.
All right. So what do you think you need to know about hazardous materials? All right. So hazmat employees are required to receive hazmat training within how many days after starting the job? 90 days. Yep. Yep. 90 days after starting the job involving medical waste. So again, we just moved Loke into a senior ES worker position. He will be taking this training, but until he does, he cannot sign off on medical waste or package or box it. He can't be responsible for it. So he will have that very soon. Definitely within his first 90 days. And then at least every, how many years after that?
3.
Every 3 years, yep. We have to renew it every 3 years. So all technicians should understand the major categories of waste that require special handling: laboratory waste, blood, blood products, blood and body fluids, pathology and anatomy waste, sharps such as, what's the main kind of sharp?
Needles.
Needles. Yeah, needles is the main kind of sharps that we deal with, but also scalpels, glass, or other sharp items. Bulk chemotherapeutic, follow federal, state, and local regulations. The U.S. Occupational Safety and Healthcare Administration, or OSHA, regulates the disposal of regulated.
Waste,
Okay.
hazardous,
No. RMW, medical, regulated medical waste.
regular medical waste.
Write that in your blank there, regulated medical waste. All right, we got all our blanks filled in.
Mhm.
Okay, and if you're unsure about a certain type of waste and how to handle it, again, just ask, we'll send somebody up, we'll identify it. If it's something that falls outside of our purview, we usually get OES involved, we'll get Megan, or it was previously Megan, or they hire for Megan. But we'll get Elizabeth or Bruce or someone from OES to come and chat with Dr. Gerber and come and check it out. Okay. What are we doing here on number 6? We're just about done with number 6. I'm gonna finish that and then probably have my meeting with Kate. Okay, so, we're gonna look at a couple of safety hazards you could run into as you're working, okay? There are a few different safety issues you may experience, and you're gonna be on page, let's see, 6.16, I think you are. Okay, so a few different safety issues you may experience as you do your daily work. Okay, maybe some of you have experienced these issues or something similar. So depending on, we're gonna stay in one group. It says divide into pairs or groups, depending on number of people, but we got a small group here. So, first scenario is a waste container, and this is in your books on 616, okay? A waste container has fallen off a cart in the hallway of an elevator. Okay? So, decide the best way to handle the situation. And then we're gonna share our thoughts. So a waste container is falling off a cart. Let's say it's it's a red, we had a red container, one of those big red totes, and it fell off a cart and it's laying there in the hallway or laying there in the hallway, yeah. So what do you do?
I'll put a precaution sign up first.
Okay.
Or a sign.
Not bad. Okay, so write some of these things down. So putting a caution sign or a wet floor sign, something to direct people like to move around it, that this is a possible dangerous situation. Okay, what else?
Call supervisor, manager.
Call supervisor or manager if none are present. Yeah, let them know so we can start mobilizing to get the cleanup effort going. What else?
If it's falling, it's in the red bags and it just tip over, I mean, we'll put some gloves on and put it back in the bin.
I think that's great. If it's within your ability to clean up, you start cleaning it up. So it's not just laying there, or help whoever tipped it over to help clean it up. Grab gloves, hand hygiene, and start again. If it's within our abilities and within something that we do, if it's red bags or if it's just regular, solid waste, yeah, we can help clean it up and get it out of the way. Okay.
And disinfectant, right?
Well, it depends on the area. We shouldn't have to disinfect
No,
if
we
it's in a
just
bag.
want to take it, get it all out of the floor.
Yeah, and we'll clean the floor
We'll clean the floor
afterwards
later.
with usually, again, if it's blood that's spewing all over the floor, it's different than if it's just like, trash bags.
A trash bag.
So we would clean it with something, clean the area after we've gotten the waste up. I mean, the example says a waste container, so that could be a lot of different things.
Yeah.
That might be part of your assessment is what kind of waste is it? Ask that question. Is it regular solid waste? Is it pathological waste? Is it blood or body fluids? Like what kind of waste is it? Because that's going to affect how we go clean it up or if we clean it up. If it's a hazardous waste and it's like a jug of xylene or formalin that fell off the cart, now you got a big problem. Now that's a hazardous waste and you got to do some, you got to get other people involved.
Even the chemo waste?
Chemo, it depends on the volume of it. So chemo waste is not something we clean up. It's something nursing is trained to clean up. It's something OES certainly can clean up. So again, the first thing we probably ought to do in addition to securing the area, like someone's, like you said first, put wet floor signs out, secure the area, make sure people can't walk through it, is the next thing we should really do is determine what is the waste? What kind of waste is it? And is it something we can clean up, or is it something we have to get other people to help? Is it something that represents a danger? You know, I mean, think about your password or your passcode for a fire, you know, rescue, alarm, contain, evacuate. Rescue is the first thing. It's a very similar response. You're going to rescue anybody that's in immediate danger. You know, and in this case, the alarm would be getting a hold of whoever needs to help clean it up. Is it OES? Is it a radiation situation? Is it a chemical situation? Or is it just a bunch of bags of trash we just need to pick up? So assessing the type of waste is probably one of the most important things. Okay. Next scenario is someone is vomiting in a common area. See this one for sure. So someone's vomiting in a common area. What do we do?
Wet floor sign.
Right? Close off the area. Okay. What else? What are we gonna do?
Clean it up.
Okay, how?
Start getting towels, some type of soap, linen to clean it up, gloves.
Hey, we missed one thing though. The question says, or the example says, someone is vomiting.
Oh, they're still doing it.
That's what it sounds like to me. They are vomiting. What are you gonna do?
I'm gonna call, I'm calling for help.
And from taking help.
Get a hold of somebody who can help this
Yeah, I'm
person.
gonna call
Like, let's help the person first and worry about the
Yeah,
mess later.
call.
You know, we
yeah.
can clean the mess up. We know that. Well, let's get this person some help. Let's call them.
Yeah,
Call for a rapid response or.
Can we
get-
call for it?
Well, we can go, it depends on where it is. I mean, we would have to get to somebody to call rapid response.
Oh, okay.
I mean, they call it overhead, but if you're in a waiting room or something like that, but the unit secretary or somebody say, hey, call rapid response, and they can call and do that. So,
Don't say stat.
well, it depends on what it is. I mean-
I found someone on the floor.
Any kind of response is gonna be a stat situation. So if it's a rapid response, that's typically when someone is cognizant, alert, not really looking like they're in imminent danger of, you know, death or other serious illness or need to be taken right away to a hospital. If someone's unresponsive, if someone is obviously suffering some sort of heart issue or something like that, then they're gonna call a code. They're gonna call a code.
Okay.
All right. So get help for the person, okay, is number one, I would say in this scenario, they're vomiting in a common area. Once the help has arrived and we've gotten things kind of situated,
Then close off the
and the
area.
area's been kind of closed off, then we proceed with the cleanup effort. All right, again, some of that's gonna depend on what type of floor. Is it on floor? Is it on carpet? And those type of things. And that'll determine proper chemical to use. You know, on carpets, we typically would use a peroxide-based cleaner to get that cleaned up. On a floor, we could just use a regular neutral. And if we wanted to, because it's a body fluid, we could use some 456 if we wanted to disinfect it. All right. Next scenario. A container is leaking as a cart is being pushed down the hallway. We see this all the time. Okay, what's the first thing we do?
Sign.
Yeah, I would say the first thing I would do if a container is leaking as it's going down the hallway is get the person to stop. Say, stop. Stop wheeling it down the hallway. The further you go, the bigger the mess. So stop right where you are and figure out what's leaking. Get it contained at the point where it's leaking. All right, make them stop and get that container sealed up so it doesn't leak all the rest of the way down the hallway. Especially, I mean, we transport waste and things like that from far away. We go all, sometimes we'll come in, we'll see a drip going all the way from CSC all the way to ASB. You know, and you know that person was just, they're just walking along and pulling the cart and it's dripping along behind them and nobody stopped them. So stop the person. Contain what's leaking or dripping. Identify what it is. You know, is it a blood, body fluid? Is it, you know, just garbage from a cafeteria or it's just coffee or something from Spot? You know, things like that. Try to identify with, you know, always remembering that we try to assume everything is infectious, all right? Assume that everything can hurt us, and handle it that way. And then proceed again with either getting it cleaned up or calling for backup to get it cleaned up. All right? All right, just some scenarios that we could run into. Any questions on any way we handle those? A lot of them are identify, keep everyone around you safe, and then proceed with cleanup afterwards. All right. Okay, so now. I already did the scenario. So there's some things that they list here in terms of the answers or things that we would follow if we look up on the screen. So waste containers falling off a cart in the hallway or elevator. They're saying wear appropriate PPE, certainly. Pick up the debris off the floor and place in the trash bag. Sweep any smaller debris and place in trash bag. And then mop the floor and place a wet floor sign over the area. Okay. The second one, for someone's vomiting, follow facility approved procedures. Those would be things like call for rapid response and help the person. Wear appropriate PPE. Apply approved absorbent or clean the majority of the spill. So if we have like, Red Z or something like that, we can put on it. If it's voluminous and it's got more liquid to it, we can solidify it. Sweep up the absorbent after a designated time frame. Mop and disinfect the surface and place the wet floor sign. A container is leaking and they say place a container in a plastic bag and tie shut. So again, get the leak to stop before you proceed any further. Mop and disinfect all the surfaces that had leakage on it. Place the wet floor sign on the area that was mopped, and then notify appropriate supervisory staff if there's an issue with the containers, and try to make sure that we're not going to have that leak happen again. All right, so we were pretty close on a lot of those. Okay. So this is on page 6.17 of your book. Describe the difference between transmission-based and standard precautions. Right, standard is always, exactly. Transmission-based apply when? Right. When the sign's up and when the patient has very specific things that cause them to be more transmittable. But they call it transmission-based. So it's, when they have a specific illness that is transmittable to others. Okay, what are 3 ways you can break the chain of infection? Hand hygiene, yeah.
And wear the proper PPE.
Proper PPE. Disinfect your surfaces, yep, that's great. Don't come to work sick. Proper habits and hygiene. Okay, those are all good examples. Some others would be proper trash and waste disposal. Getting vaccinated. Making sure that you're practicing good health habits and hygiene. So all good answers. Identify, okay, the isolation room signs. What are the different, what are the types of isolation rooms we have? And the signs for them.
You have contact.
Yep, and then we have our own personal contact plus. Yep, so those are the 4 that we have. The main 3 they're gonna always talk about are that contact, airborne, and droplet. Okay. Okay. Name PPE used in isolation rooms. What's the different types of PPE we might use?
Gloves and gowns and masks.
Yeah, mask. What?
Respirator.
Respirator, yeah.
Respirator. I keep forgetting respirator.
What else might we use if needed? Splashing or splattering. Goggles, yeah, goggles or face shield. Splashing or splattering could occur. Okay, 2 cleaning steps that are unique to isolation rooms. So what are 2 things we discovered we do really only in isolation rooms?
Oh, 2 cleaning steps.
Yeah. So what do we do in an isolation room that we wouldn't necessarily do anywhere else?
Oh, we would disinfect,
Use of PPE.
yeah.
Yeah, the PPE might be different that we would do in an isolation room. You're gonna use different PPE. Yeah, that's one thing.
And different solutions. It all-
Could be different solutions. Yep. No, exactly. If it's C. diff, we're gonna use the bleach product. What else? Well, we listed 2, but there are a couple others.
Yeah, some other big ones that you would do.
In the isolation room?
Yeah,
Yeah.
what would you do? It's different.
Oh, that's different. Which one?
Picture each part of the room. What would you do differently in the isolation discharge than a regular?
That's in every discharge.
Wipe down the
Okay,
tools.
You gonna
What's
wipe
that?
down everything?
Wipe the tools after use.
Wipe your
Yeah.
tools after use, yeah, before you move into the next room, excellent.
There's something else you would do in the bed area and the bathroom that you would do differently than a regular discharge. Think about what's in the bathroom, what would you do different?
Shower curtain.
Yeah.
Yeah.
Shower curtain and cable curtain.
Curtain.
Yeah. Perfect,
And shower curtain
yeah.
And privacy curtain.
and privacy, because we don't got it.
And you don't, yeah, you don't have it in
Yeah.
your rooms. Okay, what are the 4 types of waste we talked about?
Hazardous waste.
Hazardous, yeah,
Medical, regulated waste.
right, regulated medical,
And recycle.
recycling, yeah.
Solid waste.
And what was the first one? Solid? Yeah,
Solid.
solid waste. Yep, that's them. Solid, recyclable, hazardous, and regulated medical. And then finally, what category of waste do sharps or needles belong to? Regulated medical, yeah. Yeah. Fantastic. All right, so that concludes module 6. Excellent, we are moving through. I have to run to a meeting, or actually 2 meetings, but Felicia's gonna pick it up from here with module 7. I think the plan will be to try to get through a chunk of module 7 before lunch. And then we're gonna take our show on the road back home to 257 next door to our office for lunch. And then after lunch, we'll mush out the second half of 7 and all of 8, and we'll call it a day.
Okay.
We're getting there, right on schedule. Oh, more cards. You want to pass it, if any of you have any more of these cards, pass them down, please. Thank you, thank you. All my junk out of your way.
No problem.
Oh, wow. Yeah, we got 3 more months.
Moving along, moving
Yeah.
around.
Okay. See you all in a little bit.
Okay.
So for module 7, the first thing we're gonna do is we're gonna do an activity. After that, we're gonna watch a video, small video. And then we're gonna go into our role in surveys and HCAPS. Good. We just talked about HCAPS this morning at our meeting. Then we're gonna finish it up with a knowledge check. And this module will take maybe about 2 hours or a little less.
And this is the occupied.
This, we're gonna talk about occupied patient rooms.
Okay. This is when the person.
Yep. This is when the patient's in the room, you got it. We already did the recap, so we don't have to do a recap on the last one, we just finished it. So do you wanna list 4 things you learned in the last session? You should be on page 7.3.
7.3.
Yep, 7.3.
There's a little section to list them.
Okay.
So what was one thing you learned in the last session?
We learned the different types of waste.
Different types of waste, yep. That's a good one to put down. What else can you write down for something you learned?
And we learned how to,
Different
Different
isolation.
isolation.
how this is isolation rooms.
Yeah.
Isolation rooms.
Need 2 more things.
And we learned, how to break the command.
Chain of infection?
Chain of-
Yeah, chain of infection, how to break the chain. What else? One more.
And we learned.
You can refer back. You can turn backstage if you want. Go ahead.
We also learned how to do a discharge cleaning. Was it, is that the same? Look, yeah, that's the
No,
thing.
it's similar, but at least we learned about discharge training, yeah. We put that on there.
A high, oh, okay. That could be one, discharge cleaning?
What about it? We didn't talk about regular discharge.
Cleaning
training.
cleaning and
Isolation room.
The isolation room, yep. How to tell what type of isolation room it is? Did we talk about that? Yeah, that's it.
Isolation.
Or the types of isolation, yeah.
Types of.
So now that we've talked about cleaning several types of rooms, we're gonna go back to occupied patient room and talk about the commonly missed tasks in those rooms specifically. We will focus on customer service and discuss the critical role environmental service technicians play in creating a healing environment for our patients. We're gonna talk that also that HCAP surveys. Now, you know that patients, after they leave here, they'll get a survey in the mail. Like, remember Matt, we're talking about our score this morning? Yeah, well, they get it. No, they don't, they get it after the fact. Yep, they get it when they get home. And then they'll ask the questions like, for us specifically, you know, how often was your room cleaned? Was it kept clean? Was the person cleaning your room courteous? You talk about the customer service. They'll ask questions about nursing, you know, commonplaces, the doctor, but for us, they specifically ask 2 questions that are for us. And that's why we go over, like, we have Press Ganey, and then we have like score in our HCAP score, which is our top box score. Like the press, like we're in the 90, I think our cleanliness was 90 point something, this 37 for last month, but that was for our overall score for Press Ganey. But just in the top box, meaning just that whoever scored us the top answer, it was like a 77, I think was this morning, around the 77 something. So we have the Press Ganey score, which is our overall score, and then we have our top box score. That means who only gave us that top rating, that score. That said, you know, always. I think it's sometimes, never always, but whoever gives us always, that counts as top box. But if someone just said it's good, but that, you know, it goes into the overall Press Ganey. So that's the differences there. So we have our top box score. That means who only gave us that top rating, and then that's why it's lower. It's like that 77, which we're used to seeing at 90. Because overall we did really good. We got 90 but the top, the one that gave us only that top score was at the 70%.
That's how that works.
Mm-hmm.
Okay, I'll push them. No.
No, but the scores are good. And then it depends. Not everyone fills out a survey and sends it back. So that's why you'll look at the insides when we put those little graphs in your in your closets. It'll tell you how many surveys you got. Because like on 5, because your pages are there so long, you may only get a few surveys back.
Right.
When Maurice has tons of patients, he may get like 70 back. So it's different. So you might see, because that's why it's so much fluctuation, like on the 5th floor. Because say you only get 2 scores, and then one gave you a great, and one just said, oh, everything was okay. That's why you get that. Like you say, well, I'm only getting 50%, but it's because you only got 2 surveys back.
Oh, because mine was in the red, yeah.
Yeah, and that's because you didn't have that many surveys. And sometimes people just say, oh, everything was fine, and just go right down the middle, and not really saying, you know, no, I really did have a good stay. So those are just different things and reasons why the numbers fluctuate so much. Okay, I'm sorry, gotta go down to the next one. That's 7, I'm assuming that's 7.
Yeah, that one.
I can't see that writing.
Yep, you're on it.
I know. We already talked about, well, so now we're in the occupied patient room. 7.4, we just didn't participate guide. We're going to review the images and circle the areas that may be commonly missed. And then we're going to explain how to clean each commonly missed area or items you selected and include any cleaning tools and chemicals to use. So on page 7.4,
Uh-huh.
we want to circle the items that are commonly missed during a typical cleaning. So look at those, in those pictures. What are some of the items that are commonly missed?
The pipes underneath the sink.
Yep, so circle those.
The handrail.
Mm-hmm. Anything you think is commonly missed, just circle it. And in those pictures. You don't have to rush. You have a few minutes to do it. So take a look at each picture.
Oh, all of them?
Yep, each
Oh.
picture, 7.4 and 7.5.
Oh.
And then there's some more on 7.6. Finish up. Then you circle the pictures of items that we commonly missed. Then don't forget to write down the right way to clean each item.
Now, for one of them, they show, it looks, I don't want to say it's blood, but it might be blood, but it looks like rust. Oh,
Yeah, that's just something under the mattress.
oh, that has crumbs?
It possibly, we don't know. It's some unknown agent.
Look like corrosion.
Yeah. I wouldn't think it's corroded, but it's something that can be cleaned.
Oh, okay, all right. Yeah.
And you may not circle each picture. So there's maybe a few pictures that may be common things we do clean and we don't miss.
It goes on to the next page too?
Yep. It goes to 7.4 to 7.6. And after one more minute, we'll get started on our review. Everybody good?
Yeah.
That's right.
So now we're review on the next slide, some items that are commonly missed here. Do those checks mark yours, match yours, areas you checked?
Yeah.
Yep, mine's, yeah.
Most people usually get their phone and even. like,
Even the, yeah,
The toilet, they, you know, we know that most people usually.
Mhm.
And they get the phone
yeah,
stuff, but it'd be the doorknob, cause I do the doorknob when I first come in, but it'd be stuff like that. Little heater thing and
mm-hmm,
up one thing and.
yeah.
People don't wipe off the paper towel thing, I don't.
Cause there was,
think
that's
it's-
why,
Mhm.
yeah.
And
I
too.
wipe it,
Yeah.
I put like metal cleaner.
You said shine it up?
Yeah, cause it would be like a dog, you just wipe it with the wipes. So I got tried, I just signed it all up, the black stuff over that, so the bathroom, but it looked decent.
Yeah, I
Yeah,
just
you can't
kind
forget
of,
the corners,
Yes.
like, especially at the bottom, like, I take them out sometime and just go at the bottom, but everybody don't do that, I don't think.
Mhm.
And the chair also, you, although that one was different, in my opinion, everybody doesn't open the chair out. Those
That's
little-
true.
Yeah, and the little rail down there, that's, yeah. You
Yeah,
know,
so-
those people, you know.
Cause I didn't know when I first started,
They open
Tyler came in one day. You know how y'all go through?
Yeah.
Then I started seeing what y'all was checking, when I first started, they didn't show me all of it. And then I seen what y'all was looking for, I was like, oh, okay, and then I started training, I just started showing other people.
So, dust event or air returns. So what can we do to clean that?
we dust it.
Mhm. And what if there's some stubborn dust on there? What else could we use to clean
We
it?
can wipe it with a.
Absolutely,
I have done that.
yeah. Sometimes they get, the dust, it gets a little, where it just doesn't come off as clean. You might need a little more elbow grease to do clean up. Oh, and then it says, did you want to, and use a damp dusting technique to properly clean? And then, given how much dust, wait until the room is empty to avoid knocking dust on the patient. Now, if it's on the wall, not by the bed, of course, you can clean that, the wall vent, but nothing above the patient. You should be dusting while the patient is in there. So the next one, seat pipes. What would we do to clean this?
We wipe them down with some hydrogen peroxide.
And then in your book on page 7.9, we would use a damp,
Oh, we
it says
would use a
disinfecting wipe,
yeah,
or hydrogen peroxide wipe is a disinfecting wipe,
we use a damp wipe.
to make sure to thoroughly get either the hairs and or the dust from the top to the bottom. Under the mattress.
So wipe it.
Mm-hmm. Yeah, because a lot of things can get stuck on the mattress. You have skin, you got crumbs, you got blood, other body fluids can leak under the mattress. So we would rinse the mattress. What would they say? We would raise the mattress. My eyesight.
No, that's okay.
If there is visible dirt or soil, first use the wet wipe to remove it from the mattress cover or bed frame. Then use a disinfectant wipe to clean the mattress and frame. Ensure the disinfectant stays wet on the mattress and frame for the dwell time listed on the product label. So if you're using your hydrogen peroxide wipes, what's the dwell time?
1 minute.
1 minute. And say we ran out of those and we had to use the 4, 5, 6 to clean the bed, how long will we have to keep it wet?
10 minutes.
Yep, 10 minutes. Everybody got that?
When you say keep it wet, keep what wet?
The bed.
I mean, do I put it back
The
down
area.
or do I just? Oh,
Yes, you put it back down because it'll just stay wet. You just gotta check, make sure it stays wet.
Okay, gotcha.
Like sometimes, like when we used to use the 4, 5, 6 on the bed, you would used to take the rag, squeeze out the rag on the bed, and
I
start
did.
wiping it.
Yeah.
So it'll stay, be wet enough. Now, is everybody, oh, you writing that down, that you should be on page 7.10. Oh, you could be going through these, you're supposed to be filling in the blanks.
Are we on 7.4?
No, I'm on, no, this is 7.10.
Oh.
So have you guys not been filling in the blanks that we going? No, you're not, no, turn the page. And then we have each single one.
What? I didn't see that.
Yep,
Oh.
so you gotta fill in your blanks. I thought you guys were filling, let me go back so you can go fill in.
Oh.
Here you
Never
go.
seen that.
There we go. So we got the Vic, right?
It's a little confusing because it looks like it's 7.4.
Yeah, 7.4, that's.
Nope,
Yeah, but move ahead and you
Go
can actually
ahead.
do your
Go
blank.
ahead and go to this page, the page that looks like that. Keep moving, keep on keeping on. Yep,
Yeah.
They have a question in blank too.
yeah, that's where the answer is right there. Remember we were talking about it?
Yeah, go back, if you go back to 7.8 and then use a wet, which is the blank dusting
Yeah.
technique.
Yeah, yeah.
And then wait until the room is blank is vacant. Yep. And then for 7.9, it's use a damp blank towel and make
There
sure
you
to
go. I'll put
thoroughly
it up on
either
screen
clean
so
the
you can
hair,
read it.
yeah. And then clean to disinfect. And then there's like the little section, so if you want to take notes. Is everybody kind of on the same page? You guys are caught up, okay. Sharita, Wanda, you guys are good?
Yeah, good.
Okay.
Copy, yeah.
Okay.
No, I never even knew the filling in.
I see you writing too, but I.
Oh, that's just right.
Yeah, it's right.
And then 7.1.
So now we're on the mattress. You guys-
7.10,
Yeah.
yep. Raise the
Okay.
mattress using
Raise
a
the mattress.
wet wipe.
Yeah, this is.
Using a wet wipe? No.
Raise the mattress. If
Using
it's
it
visible,
disinfectant.
Yeah,
Yeah, or wet wipe, yeah.
disinfectant, wipe to clean, make sure to remove all debris, allows the wipe to stay on the mattress for the
12.
Well,
Well,
time.
Well
Yep.
timed.
12 time that is necessary.
Okay.
You got your first one? Disinfectant wipes?
Yeah. Yeah, I'm gonna really study.
What would we do to clean this area?
We'll use the wipes, disinfectant wipes.
Yeah.
And we'll do it in a one direction.
Yes, we will. So, and then we may need to use a little extra friction on the chair if it's a little,
extra friction.
So
Yep.
friction is the blank.
Okay, friction. Is it elbow grease or friction?
Friction.
What, clean using extra friction?
Friction.
because on there, it's showing that, you see how it's a little discolored on the chair?
Yeah.
So they're saying that we might need to have to use a little more friction, which another word for friction is elbow grease. Yeah.
Yeah,
remove it.
really, the
Yeah.
magic eraser will
Yeah.
take that out.
Mm-hmm. Now, our stainless steel paper towel holder.
I hate stainless.
What would you do to clean that?
I don't like this stainless steel stuff. you get.
Use a blank blank.
Stainless steel plate.
See, he's
Yep.
saying use stainless steel cleaner.
Yep.
Yeah,
Yeah, that's perfect.
because for stainless steel, you have to use, well, of course, we want to disinfect it first. But to polish it and get it looking good, we want to use stainless steel cleaner. What about these corners and edges?
Use a blank blank.
Zero.
Like, how would you clean that? Let's talk about.
I
the
would
front.
mop, I would probably,
Well,
yeah.
or damp white.
I would-
Yeah.
I had that before, and what did I do to get that off?
You may have to spray it, let it sit. in the
I
ground.
sprayed it, I used the green
Depending
pad.
on how built up it is and the.
Yeah, I used the green pad, that's what helped me get.
So
What is
first,
that, damp mop?
damp mop to get all the debris out of the corners and edges. And then we'll use a wet mop to get into the corner.
The dust mop.
First dust mop, and then we'll use a wet.
The wet one.
So it's good that you guys were able to identify all the ones that are the areas that are sometimes overlooked. So that was very good. But isn't it better to just avoid making this, mistakes? So that's why we're giving you this training, so you can train people to just avoid that and get all those easily missed areas
But
from the beginning.
You know what they didn't put on here, and I'm a little disturbed with,
What?
is that they didn't put the garbage can.
Yeah. Yep, because that can be, well, a lot of our people that are in their areas regularly clean their garbage cans. So I can see how like it could be an easy miss area, but I don't think it's enough for us. We have to clean the trash cans
I
around.
know, because I clean them.
Yeah,
I make sure mine.
Yeah.
And if I see one coming in, and no one did it, I do it.
yeah. So we have a really good clean trash cans here.
They've gotten better now. Oh, because the other ones,
So now we're gonna pause there and go for lunch.
Oh, really? This
Yes,
is it?
yeah. So it is about noon.
Okay.
So we're gonna be, when we come back, we're gonna be on page 7.14,
And we're gonna be downstairs.
and we're gonna be downstairs.
I'm gonna be downstairs.
Yep.
We're going back to the old
Back in our room. We're going there to
Which
eat,
room? Which room?
257.
The one we were in yesterday.
Yep. Because we weren't there originally because there was some, things booked in there, but then afternoon meetings got canceled. So since we gotta go for lunch, we can just stay right there the whole time.
Okay. Right.
I take it yesterday.
You like the almond? Put it in there. It's still cold? Oh. Mine don't stay cool. That's why I stopped bringing them a lunchbox.
No. Because it doesn't stay cool all day. But I put it in the refrigerator until I leave out.
Oh, that's a good idea.
This, yeah.
Put this,
Yeah.
you put stuff, okay. Maurice, is this your water?
Yeah.
Okay. Oh, yeah.
Okay. But this is a daily, you have to make sure that's. Daily.
Oh, you're fine. Thank you. Appreciate it. There we go. I got it now. Yep.
I'll log that out.
Oh,
Or does
yeah.
that screw you up with the recording?
Okay.
How's your morning going? I just feel like you just do so much of
Oh, this is,
everything.
man, we should do most of this. I'm just filling in for
I'm
this.
saying, but basically the basic stuff, just like when somebody's time is not right or whatever, because you're like, oh,
Oh,
I
yeah, they do the payroll this morning too, which was hectic, but we got it all done. People have been the punching's been all over the place. I don't, I know they tell me I'm not supposed to fix it, but if I don't fix it, people won't get paid right.
Yeah,
Cause it's a bad, it's a bad habit to keep fixing everybody, but,
yeah.
I can't, people's paychecks are important. I know, they should know how to do workday by now, but still, sometimes the machines are screwy, it's not,
Yes.
it's not the people. Yeah,